Perfect.
Okay. So the first item on the agenda, elect the presiding officer of the board.
I make a motion that we elect Roman Zelway for chair of the board.
I'll second that.
Thank you, everybody, very much. Okay. All in favor?
I make a motion that we appoint Dwayne as vice chair.
I will second that. All in favor of the motion for Commissioner Simon to be vice chair, say aye.
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 Thank you.
Okay. All right, now we have the lovely Shelly Murphy from Helena
Thank you.
with MACo.
All right. So, do you maybe tell?
You guys can come up to the table and be part of the
You
discussion.
can hear better if you'd like.
And Taylor, here's
Now we know Tim's secret.
keep one of those for yourself. Wow.
Still can't coach some of them.
I spent the night in the car.
You did?
Well, I didn't.
Oh.
He's did, so we're kind of cold.
I was gonna say, boy, you must have came to St. Regis last night. Didn't fall?
Is there anything else that we need?
Casey, do you guys have? What is today? The 6th already,
That's
right?
it.
Of 2017.
I know. 1/6/17 already. It's crazy. All right, grand. Well, thank you for inviting us to come over. It's my understanding we are going to visit a little bit about maybe some potential options for Mineral County and ways that we can reduce some spend in regards to the employee health insurance side of it. So what Taylor handed out is this benefit summary. This just talks about the different plans. We've gone over this lots during open enrollment. Nothing's changed as far as the benefits as of right now. Now, keep in mind, you guys are a July 1st renewal group. So one exciting thing that will happen is we are changing our pharmacy plan. It is not reflected in this because, of course, this is from last year's open enrollment, which is the current benefit period you're in right now. I'll talk just a little bit about the pharmacy changes. It's all for the better, so it's really exciting. I think it'll be really good for some of our members that have been faced with paying higher money for prescriptions. So that's one thing that's changing on the medical side. And we're also rolling out an employee assistance program. That's another added benefit to the MACo Healthcare Trust medical membership. Again, that's not something that's going to affect this conversation, but it's not reflected in here. So I just want to let you know that this primarily will stay the same as far as the benefits, how things pay, and as we go through and talk about some of these and maybe compare some plans and the cost of them, just know that the benefits aren't changing in the plans with the exception of those two things, and those are not takeaways. Those are positives for the employees that are on the healthcare trust plan. The other thing that I handed out is this rate sheet here. This rate sheet are the rates as of last July 1st, okay, that are current rates that Mineral County is paying is this very top one, this RM 1500. That's the current plan that Mineral County pays for the employees. We do not set final rates for July 1st of 2017. Those will not be set until mid-February. So I pulled this list using last year's rates, but just so we know and we understand for the three of you as well, these will change a little bit based on whatever the rate renewal is. At this time, we'll set preliminary rates right around January 26th. We have a board meeting. I think the overall average of the trust is looking really good. I don't expect a very high rate increase at all for the average. And our board of directors, as they have in the past couple of years, could use some of our surplus money that didn't spend on claims that our actuary anticipated it took this much money to pay claims, and we haven't had those claims come in, so there's been a little surplus. Our board has used that the past 2 years to buy the rates down to zero. That could happen again this year. They could buy it down to a very minuscule amount. I'm just not sure where we're at yet with that, but I do feel that we're having another good claims year, so I don't look for the rates to be overly high rate increases. Likewise, just to, as a reminder, when our actuary sets the overall rate renewal for the entire pool, not just Mineral County, but the entire MACo Healthcare Trust pool, if he sets that rate, for example, I'll just use 5%. Then he looks at each individual county, and based on that county's claims utilization, he will adjust possibly your rate renewal. If you're performing better than the average of the trust, you could get a decrease in rates down 10% from the average. So if the average is 5%, a group potentially could receive a negative 5% rate reduction because there's a fluctuation of 10 there. On the other side, if a group is performing worse than the average of the trust, you would never receive more than 5% above that average rate renewal. So if it's set at 5%, the most a group could ever get is 10% in that year. Okay, so there is rate protection in there. Like I said, I think we're performing really well. I'm not sure what it's going to come in at, but I just want to reiterate, these are this is last year's numbers, so it doesn't take into account what our rate renewal is yet for this year. Once I get that information and I have a little more direction from the county on where we want to go or what we want to do with rates, then I'll come back. It'll probably be in early March, and that's when we'll go through and Mineral County can tell me we want to offer these plans and this is what our contribution is going to be. Then we'll get all the open enrollment material rolling and then come back for open enrollment. So this just gives us a starting point for ideas. Okay, so when we talk about benefits, as I said, the county currently pays for the RM 1500 for the employees at this time, and that is at a rate of $706 per employee per month. That, if I'm correlating it with this booklet, is this very first plan here on the left-hand side. It's under Revised Major Medical. We call it RM. And then it's the very first one on the left-hand side that says 1500. You'll note there are two other plans underneath those Revised Major Medical headings. One has a $2,000 deductible and one has a $3,000 deductible. These are already plans that the county currently offers. However, they have chosen to always pay for the richest, so to speak, plan, which is, by richest, that definition is the lowest deductible and lowest out of pocket, okay? As far as what is covered in all three of those plans is identical. They are exactly the same plan. The only difference, deductibles and max out of pockets. Then if you correlate that with the rate sheet, however, you can also see that the higher the deductible, the lower the premium. So those are options that Mineral County could look at paying as a whole for an employee and be able to reduce some costs. And we haven't talked about it yet. I know we've talked about it in past years, but possibly if you're looking at employee portions, it just sort of depends on where Mineral County's budget falls and what we need to do on the county side of it. But I did run some numbers. If we look at the RM 2000, which is $658 per month, this is based on we have 46 employees enrolled right now. So based on that 46 active employees, if we move to the RM 2000, that would save approximately $2,200 a month, which annually would realize about a $26,500 savings to the county. Again, the only difference, now speaking to the employees as well, the only difference in those two plans A $1,500 deductible is what you currently have. That would be a $2,000 deductible. And as far as the max out of pocket, again, max out of pocket, that's the most amount that you would pay in any one plan year if something catastrophic happened. Currently, that's at $3,000. If we look at that next plan up, that would go to $4,000. Okay, that is the only difference. Prescription's the same, benefits are the same, the way things pay, all the same. Then likewise, if we look one step further at that RM 3000, you can see that premium is $618 a month. When I calculate that out, that's a $4,050 a month savings, realizing about $48,600 a year savings in medical costs. And then I'm going to take it one step further as well, just to put some numbers out there. The basic medical plan, which is the one on the right-hand side, it's a little bit different than the revised major medical. It's got a $2,000 deductible, $4,000 max out of pocket. What it doesn't have the prescription program that you're used to on this revised major medical. That prescription plan that's included with the basic medical plan is essentially prescriptions are built into the medical. They're integrated into those medical deductibles. So currently, if you're on one of the RM plans now, you'll go to the pharmacist with a $50 deductible, and then you're going to pay either the greater of 20% or $10, the greater of 30% or $20, which these are all on the back here. That's your current plan. It's a percentage or a copay. On the basic plan, if that is something that the county wanted to opt to pay for in its entirety for the employees, that pharmacy, if you go to the pharmacy, you're still going to have them run your card. However, you as employees would pay the entire cost of that drug until this $2,000 deductible is met, because pharmacy is integrated in to the medical plan. So this deductible on the basic plan can be met either all medical, all pharmacy, or a combination of medical and pharmaceutical. Okay? And then once deductibles met, pharmacy and medical pay at 80-20, meaning we pay 80%, the employee pays 20%. Your max out of pocket is $4,000. That means that once $4,000's hit, whether it's all pharmacy, all medical, or a combination of both, then the plan pays 100% of everything after that point, including pharmacy and medical. Okay? So that's the biggest difference I would say with that basic medical plan, is there's not separate pharmaceutical coverage. It's integrated in. Okay? But when we look at that basic plan, it's only $567 a month. If I take those calculations, that's realizing about a $6,400 a month savings, which is about $76,700 a year savings on the medical side. So that's a significant savings, but it does change the benefits to the employees as far as how things are covered or how they're paid.
Did you just say that it was 80-20 deductible?
Sorry, 70-30.
Okay.
Yes, thank you for
Okay.
correcting me. It's a 70-30 after deductible.
Okay.
We pay 70%, you pay 30%. Thank you.
Okay.
Up to the 4,000.
Up to $4,000. So when I look at the basic plan compared to this revised major medical plan that has a $2,000 deductible, $4,000 max out of pocket, same deductibles, same exact max out of pockets. The only difference on the medical side is not what is covered, but how they process, how a claim processes. So on the revised major medical plans, if we look at physician office visits, just to go to the doctor, we actually waive the deductible on those revised major medicals. So when employees goes to the doctor, you're paying 20% of the cost of that medical appointment, no deductible. If we look over here on the basic plan, if you go to a physician office visit, it applies to your deductible. You're going to pay your deductible essentially before the plan pays anything on this basic medical plan. Okay? Where on the revised major medical plans, There are, remember we've talked about first dollar coverage in the past, what I consider common uses of health insurance, the physician office visits, first $600 in diagnostic lab and x-ray, chiropractic, mental health and chemical dependency. All of those things, we waive deductibles for those items, meaning that you don't have to meet this $1,500 or $2,000 or $3,000 deductible before the plan pays. The plan just automatically pays 80%, you pay 20%, okay? On the basic plan, you're going to pay your deductible before the plan pays anything. Okay, so it's not what's covered that's different, with the exception of chiropractic. I will say that, and I'll talk about that in just a second. It's not what is covered that's different, it's how the benefits process on the medical side, okay? Now, to throw one more wrench into that, on the basic medical plan, there is a small first dollar benefit. The first $300 in medical claims that come in, we pay for it 100% on the basic plan. So that's probably 1 or 2 office visits. We pay for, the first $300 of medical that comes in, we just pay for that, and then after that, everything applies to deductible. Okay? That $300 does not apply to pharmacy. Pharmacy will go right towards your deductible. All right? And the other thing on the basic plan, as I mentioned, chiropractic is not covered on the basic plan. Just simply not covered. Other than that, what is covered is identical for both of these plans. Okay? And then pharmacy is the other big guy on the basic plan because it's integrated in. Now, I do have several counties. This is just some background information. I have several counties that pay for 100% of the basic plan on their employees' behalf. It is the lowest cost option in terms of premium. I have lots of counties that pay for that. If we have employees that have pharmaceutical needs on that basic plan, I then talk to them about flexing dollars, because you can put money into a flex account and use your flex money to pay towards those prescriptions, which are going to go towards your deductible.
Has that changed? Can we put more in? Or is that
Right
staying
now,
the
it's still
same?
$25.50. I haven't heard any different as of yet, but that's the most you can put in as of right now. So if somebody flexed the $25.50, I believe that's just over $200 a paycheck if you're doing it every 26 weeks, and if you're monthly, obviously, that'd be a little bit higher, but if you flex the full $25.50, obviously that's more than enough to cover your deductible, plus an extra $500 to go towards your max out of pocket if you spent that much. My word of caution, if you're flexing, it's use it or lose it. So if you don't have a need to use it, you don't want to flex the full amount. You only want to flex what you know you can need. If you have pharmaceutical needs, that's where I see it the most. Or if you have a planned procedure, maybe you know you're going in for a shoulder surgery, or you know you're going to have knee surgery or hip surgery, whatever it might be. If you know there's a planned procedure, you're going to spend that money, flex the full amount. If you have pharmaceutical needs, you know you're going to spend that money, flex the full amount. Flex dollars come out before taxes, therefore it lowers your tax base. So if you took out, let's just say, you guys are monthly paychecks here, right?
We do the 26.
Oh, you do? Okay, so it's a little over 200. Let's just figure 200 for ease of math. You'd probably really feel about maybe 170 out of your checks. And I sit here, these are tough conversations, but I sit here representing MACo, and we have to have due diligence to the county in regards to talking about benefits and how they can look at helping the county's financial side of it. But on the other hand, I sit here also as an employee looking at benefits and changing benefits and how that may or may not affect us as employees as well. So I work both sides of it and tell you what is good for the employee, what is good for the county. It just sort of depends on what comes together and what direction I get from the commissioners as far as where we go. But I want to be honest about the different plans and how they're covered. I want to give the county the savings for each different plan when we look at that. And everything we've talked about so far and those savings numbers don't include any contribution from the employee yet. So that's still letting the county pay 100% for one of these plans for employees. So from that point forward, that would be a county decision to decide on a contribution, what plan, if they want to pick one and pay 100%, or if they want to say this is the straight flat dollar amount we're going to give, anything other than that, the employee picks up. So that's kind of the direction that we have to get from the county.
So can we decide which one we want, or is this just you guys deciding we get this now, we pay this now? Or do we, as employees, say, okay, I want this one or I want this one?
Sure, that's a good question. So the way that it works is once final rates are set, I come back to the county and I present a rate sheet that looks similar to this. These are the plans at the top that the county currently offers to you as employees, meaning that when you come see me during open enrollment, you can always choose one of these plan options right here, okay? The county does have the option, if they wanted to offer some of these plans down here. These 4 plans down here, the county does not offer currently to you as benefits, okay? The 2 top ones, RM 500 and RM 1000, exact same as these RM plans that we've talked about. The only difference is the top one has I better look at it this way, a $500 deductible, and that RM 1000, that's a $1,000 deductible. So you can also correlate, those are going to be higher premiums. So those are probably not going to be good plan options to offer. However, if somebody wanted it, they'd probably have to pay the difference. That's going to be a lot out of pockets. I just don't think that those are good plan options. One thing the county could do is look at offering one of the high deductible plans, the HD 1400 or the HD 3000. High deductible 1400, that's really not that big of a deductible, and the max out of pocket is $3,600, but you can see the premium is only $672 a month. High deductible plans are just a little bit different beasts. One thing that some counties really like, and the employees really like about offering a high deductible plan, is that if you are on a high deductible plan, you then have access to be able to set up a health savings account. Health savings accounts are similar to a flex account, except they are not use it or lose it. They roll over from year to year to year, and a health savings account, it's your money. You take it with you if you leave. So a lot of people like the health savings accounts. And really the high deductible 1400, that's really not that high of a deductible with a $3,600 max out of pocket. It's not a bad plan. And it's $672 a month. When we look at the high deductible 3000, that's a $3,000 deductible, $5,000 max out of pocket. Again, exact same deductible and max out of pocket as the RM 3000. But you can see the premium is only $557 a month. High deductibles, when I say they're a little bit different beasts, yes, you can access a health savings account. Biggest thing, first and foremost, is that literally, other than preventative, insurance will not pay a thing until you've met that deductible. You know the colonoscopy and mammogram benefit that we talk about, where we don't care if it's preventative or diagnostic, we pay for it at 100%? That is true on any of the RM plans as well as the basic plan. On a high deductible, that is not true. If it's diagnostic, it goes to your deductible. The only thing that can be paid for on high deductibles is preventative. That's it. So there's a little bit of risk in costs out of employee pockets there, but a lot of people do like the high deductibles because you can access then a health savings account.
How much can you put in that? Is that?
I think that one's at 35. I think it's right at $3,500 a year. And then if you're over 65, there's a catch up where you can do an extra $1,000 a year into that as well. And again, that's all on a pre-tax basis, so it does lower your taxable income. You can take it with you when you leave. You can spend it on the exact same stuff that you can with a flex account. One thing about a health savings that is neat is that depending on who you have manage your health savings account, once you get money in there, it actually gains interest. You can earn interest on a health savings account money, where a flex account you can't. And a flex is use it or lose it. The other thing that's probably one of the biggest differences between a flex and a health savings is a flex. Let's say you nominate $25.50 as your deduction for the entire year. On day one of the plan year, you can use that entire $25.50. With a health savings account, you cannot spend it till it's in there. So if you're using it to pay for prescriptions or medical or something, you can set up automatic payments. Or if you're getting prescriptions, you'd have to make sure that the money's in there before you actually tried to use it. So you can't spend it till it's in there. With a flex, you can spend it day one. Those are some differences that we can talk about. And at this point, a health savings account doesn't apply to you because you don't have a qualifying high deductible plan even offered for employees to take. But that is something that we do have some counties looking at doing. And we do have some counties that offer high deductible plans. And let's just use this $672 on the HD 1400. The cost is only $672 if Mineral County says, well, we're going to give $700 per employee, and it only costs $672. That extra $28 the county puts into a health savings account on the employee's behalf. We have some counties that do that. We have some counties that just say, nope, this is the benefit. That's for the richest plan, or that's for this plan. If you choose not to take that plan, you lose that extra money. We have it go both ways. So again, it's really up to the county on how they want to work that. I'm just trying to simply talk about options that we can look at for both sides that might be agreeable. The other thing with a high deductible health plan is, and this is probably my biggest word of caution, high deductible health plans are fabulous if you are only on the plan by yourself, meaning that you don't insure a spouse or family members on the plan. The reason why I really throw caution out there if you're insuring anybody but yourself is because when we look at, I'm going to use the HD 1400, when we look at the HD 1400, you've got a $1,400 deductible, $3,600 max out of pocket. However, if you insure anybody but yourself, you automatically have to assume the family deductibles, which is going to be $3,600, and the family max out of pocket is going to be $6,500. And it doesn't matter if one person has to meet that deductible or a combination of everybody you insure. That is the only plan that is like that. When we look at these revised major medicals and the basic plan, and you see that it says individual deductible, individual max out of pocket, that's truly what each one of you would have on that plan. So, Mary, you get sick, you might pay $3,000 max out of pocket, and your spouse hasn't met a dime of his deductible yet, and that's okay. On these plans that are currently offered, when you look at the family deductible and the family max out of pocket, think of those as safety nets. You would never pay more than those family amounts for your entire family to be insured, or a spouse or whomever it might be. Okay, so there's safety nets on these plans. If you had, let's say, Roman, you had a spouse and 5 kids insured. On your current plan, something happens to one of your kids, they fall on the playground and break a leg. That child, you know that's going to cost you $3,000 on that leg. Your spouse and your other 4 kids and yourself haven't even met a dime of this deductible. Your one child, all claims are paying at 100% because that child that had the broken leg has met their $3,000 max out of pocket. If anything else happens to that child, it's paid for at 100%. The rest of you haven't met a dime of yours. So benefits, deductibles waived, whatever it might be. Then, God forbid this happens, but it's an easy example. You guys are all on a family vacation in the minivan and something, you get in a wreck, and all of you have to go to the hospital. Well, if you have 5 kids, your wife and yourself insured, we don't want somebody having to pay $1,500 deductible, $3,000 max out of pocket for each one of you. My gosh, times 7, that could be $21,000 out of your pocket if we're looking at max out of pockets. What this family max out of pocket means is that a family like I'm describing would never pay more than $6,000 in any one plan year in costs, and then benefits would be paid at 100% for everybody insured on your plan. Okay? So think of them as safety nets on these plans, but when we look at a high deductible, and it's not even offered yet, but it's an option. If we look at a high deductible, if that one child breaks the leg, that one child would have to meet the family deductible and the family max out of pocket for that one child. You guys can still be healthy and nothing, but that one child would have to meet that $6,500 max out of pocket. So that leg then becomes $6,500 instead of $3,000.
Right.
But the good thing on that is once it's met for the entire family.
So the minivan crash would cover everybody 100% or
Yeah.
80%.
Yeah, yeah. So that's my only throw on caution is if you're insuring anybody but yourself on a high deductible, the deductible and max out of pockets work just a little bit different. There's still a safety net because once it's met for everybody, but you'll meet it whether it's one person or a combination of everybody insured. Okay? So again, those are more options that we can look at. The other thing I do want to throw out, and this isn't a huge cost saver, but last year Mineral County signed up for paying employer-paid additional employee life coverage in the amount of $10,000 per employee. Plus, Mineral County signed up to pay an additional spousal insurance as well. It's not a huge dollar amount. It's about $250 a month to offer that to all of your covered employees. However, it would be about $3,000 a year savings if Mineral County did not pay for those spousal and additional employee life. Keep in mind, as employees, you get $25,000 worth of life insurance included with your medical plan. So this was an additional $10,000 that Mineral County is paying for as an employer-paid life, plus an additional $5,000 for spousal life. That's, in my opinion, an easy thing to cut. Like I said, it's not a huge cost savings, but it's $3,000 a year-ish. And as employees, you also have the option, and I know several people did sign up when we switched to Unum, but you do have the option to purchase additional life on your own and additional spousal life as well. But you automatically get the $25,000 just for being enrolled in the medical plan. So that's an easy way to save $3,000, and then from that point, we just look at what we can do on the medical side of it. Any questions on the health plan side of it? As far as the different options and how the different plans work a little bit? Like I said, I just want to be fair to both the county and the employees and explain the differences, the major differences between the plans. I haven't had any conversations with the county. This is our first conversation that we've had in regards to maybe changing some employee benefits. So I want everybody to be educated in the best way that we can as far as what the major difference is. So moving forward, as the commission has to make changes or decides what they're going to do, then it's fair everybody sort of understands where we're at and what the different plans are and how they would work.
Is there any changes to dental or vision?
No.
That all stays the same?
All stays the same. Yeah, that's all the same. And again, well, I'll talk about this real quick. The only changes that we know of currently, we are also looking at asking for a small hearing aid benefit to get put in. I don't know how much it will be. Yeah.
Great.
What? But I'm hoping maybe it's $1,000 or $2,000. It's something. So we've been asking for that for several years, and it's finally getting worked in. So I don't know what that is, but I'm looking forward to a hearing aid benefit. It'll probably be some sort of a lifetime dollar amount. The employee assistance program, you already have, if you're on the revised major medical or the basic plan, through your medical insurance. If you go to a mental health counselor, your first 3 visits are free. We pay for those at 100%. And then after that, on these revised major medical plans, we waive the deductible. You just pay your 20%. Okay? We also have an EAP program that we're rolling out through Unum, actually, our life insurance vendor, where in addition to your medical benefits, or completely separate from, you'll get 3 free visits per incident or per issue with this EAP program. So I tell people we're just rolling it out. You'll be getting a mailing in the mail. If they bill it through insurance, first 3 visits are free, and then after that, deductibles waived, you pay 20%. However, if you use the EAP program, 3 visits are free per issue. So that's a great option for your employees to be able to use, not have to run it through insurance, and not have any cost associated with it. And that will stay regardless of what plan options or whatever happens as far as the county premiums go. And that, the other thing with the new EAP program, which we feel is really, really cool for the counties, we now have access to a critical incident counselor. So if you have something major that happens at the county and the county wants to call in some counselors to have group critical incident debriefings, we now have the option to do that as well. So we've had a lot of need for that in the past year, and we didn't ever have access to that, and now we do. So we feel that's a great benefit for the county and you as employees. We see a lot of it, detention centers, sheriffs, that sort of stuff. The pharmacy apply to the revised major medical plans, because remember, the revised major medical, these RM plans are the only ones with a separate pharmacy plan. We're looking at the basic or a high deductible, your pharmacy is integrated into your medical. So if you flip over to the back of this booklet, and we look on the left-hand side, that pharmacy plan that says standard plan, currently $50 deductible. In your 30-day or 90-day fills, you can see you're going to pay the greater of 20% or $10 for generics. Preferred is greater of 30% or $20, so on down the line. Our new pharmacy plan, we contracted with a company called Innovative RX Strategies. They are consultants we used to go through and look at our pricing contracts with Caremark, who is our current pharmacy benefit manager. Okay, they process our claims for us. When they looked at that pricing contract, they were able to negotiate a new contract with new pricing and new drug rebates in there, where we were actually getting the rebates credited back to our account. It's realizing about an $800,000 a year savings to our pharmacy plan. So Pam and I, from a marketing standpoint, to bringing new counties in, as well as sitting across the table from many of our members that are looking at us saying, I can't afford to pay $300, $400 a month for my insulin, or whatever that might be. We've been asking for a new pharmacy plan for years. When we were looking at realizing this savings, that was the time to move on it. We can implement a new drug program without it costing our member counties any additional in premiums. That was our biggest key. We don't want to increase benefits if it's just going to increase their rates. So by realizing this drug savings through contract and rebates, we were able to implement a new drug plan. So we're really, really excited about it. The new drug plan, you will have generics, will cost nothing at all. They're 100% free. Preferred drugs, you will have a $25 copay, flat $25 copay. That one to me is huge, and it really hits home for me. I'm super excited about it because I care a lot about all of us as employees. I sit across from grown adults that tear up and say, Shelly, I have to be on this medication, but I can't afford $300 a month. I can't afford $500 a month. Who can? My gosh, that's a car payment. So at our current plan, you're going to pay the greater of 30% or $20. You're always going to pay 30% of the cost of that drug. It's huge. They're going to pay $25 now. That's huge.
Yeah.
And you can count on every single month it's $25. It's not going to fluctuate with the drug costs or what a certain pharmacy is charging for a certain drug. I've had a lot of people, even in Mineral County, that say, well, if I go to this drugstore, it only costs me $40. And if I go to this drugstore, it's $57. We're not going to have that anymore. It's going to be flat $25 copay. Non-preferred drugs is going to be a flat $50 copay. Do you know how huge that is? That's huge. I know there's people in this room that have medications that they are paying an astronomical amount for each month. and have figured out a way to live with that. And now this new pharmacy plan is a way that they'll be able to realize some savings and be able to count on and say, okay, it's $25 a month. Diabetics, they need that insulin. $400, $350 a month. Now it's going to be $25 a month. That's huge. So I'm really excited about that. We're also leaving the max out of pocket in there, $1,550. That's going to be your max, meaning that once you pay $1,550 worth of drug costs in any one plan year, we pay for 100% after that. Obviously, at $0 copays for generics, $25 for preferred, and $50 for non-preferred, most people are not going to hit that. However, with the specialty drugs, those are the RA, the cancer, the MS type drugs, those are going to be a 30% coinsurance, okay? So those still have a percentage coinsurance on them, but the people that are taking those will hit that $1,550 in the first month or two. So we're still leaving that protection in for our members to have that $1,550 max out of pocket, okay? So super, super, super exciting about this drug plan. Humongous benefit increase for the members on the healthcare trust.
And that also goes for the 90-day supply, if you're getting them.
90-day are just a little bit more than that, but yeah, it's a flat dollar copay.
Wow.
Yeah, it's usually right around double. All right, and I can give you the exact numbers. I just don't have them off the top of my head.
Oh, yeah, that's right.
Yeah. So they're just a little bit more than that, but it's usually right around double. I think it's like, I want to say maybe 60 and 105 or something like that for copays on those.
That's cutting it.
Huge,
Yeah.
huge. Yeah. So we're really excited. And as far as potential new counties, because obviously when we talk about rates and rate setting, we look at the entire trust. Well, if we can bring in new counties, that adds numbers to our entire family. So one of the things that we have been lacking, where I think we fall down when we're looking at new counties, has been our drug plan. So with this change, I think that really makes us viable out there and really competitive as far as our plan offerings. Our medical, hands down, best one out there, our medical plan and how those work. Of course, our customer service is really good.
Yes.
But I think the drug plan will make us really marketable. So that's exciting as well for the marketing side of it.
How many counties do you got?
We have 26 counties right now, fully pooled, and then that doesn't include our dental and vision only counties. So, but I know of, I think 2 counties that are really, really, really interested. We just had to make some changes in our drug plan. And I appreciate that because those counties we've talked to in the past and the commissioners didn't want to make that change because of the adverse effects on their members with the drug plan. They would be worsening as essentially their drug plan. So I'm really excited that this makes us competitive, and I think we'll be able to add to our family, which of course spreads claim cost even more, which helps in our rates too. So there's several reasons I'm really excited about that. So those are the couple of things that I know are coming down the pike and that will be effective on our 7/1 renewal. The EAP program is already in place, and like I said, you'll be getting mailings on that, so feel free to use it as much as you want. There's no limits on that. The only thing is it just says three visits per incident, but you can easily change your incident every time if you need to do that. So, okay. Any questions for me?
How many spouses do you have on the program for Mineral County?
Mineral County, our spouses are limited. I don't have an exact number, but I know it's limited, and we've looked and talked a lot about spousal coverage in Mineral County specifically, and in so much as that we even talked about possibly taking spouses, making them not eligible to be on the plan so that a spouse could go out to the exchange and get a subsidy. However, the attorneys got involved and said that as a governmental entity, we can't do that. It's illegal. We have to offer coverage to spouses as well as county employers.
Why is the spouse rate so much higher?
Well, it's not actually higher. It's right about double what the employee-only cost would be. So if we look at this rate sheet, let's just look at the RM 1500 because it's the top one. It's $706 to insure an employee. That's what the county pays on your behalf. Member spouse rate is $1,400. So it's just double, exactly. Well, $1 less. So if you insure a spouse on that plan, you're going to be paying $705 to insure your spouse. The county pays your $706, you would be paying $705. But so when you look at these rates,
The county doesn't pay the 705 for a spouse,
No.
they pay the $706 for you as the employee.
right?
You would have to pay the additional $705. So when you look at these rates, as you go along here, I'll look at just the member spouse side. This $1,411, that is to cover you and your spouse. That's not what it costs to cover a spouse. That's for you and your spouse. So then you
Ours
have
are
to,
made so simple that it just says spouse at the top.
yeah. So that's the total rate for a member and spouse is $1,411. Then you have to subtract what the county pays for your premium, which is the $706 currently.
And that leaves 705 in the balance.
Yeah, so that's what it would cost. So spouses are always double, just about exactly double what it costs to insure the employee. And that's what you'll pay.
Okay.
So, relating to his question, let's say that Tim's getting the 706 paid by the county, but for his spouse, he doesn't want to pay 705. Can he elect for the spouse a lesser one? It's got to be the same.
So he can elect a different plan and still get the 706 contribution, but they have to be on the same plan.
Oh, okay.
So what, like Tim, you could look at, let's just say the RM 3000. The premium for that is only $1,236 to insure you and your spouse on that. If the county still contributed their 706, which they do currently, then you would be paying about $500 and let's just call it $30 to insure your spouse on that plan. So you're always going to pay the difference of what the premium is less what Mineral County pays. That's your cost. Does that make sense? Okay. So yeah, they have to be on the same plan,
Okay.
but they can choose different plans.
Okay.
And I know at least one person, potentially one more than that, that actually insured an entire family, and they took the basic plan because for an entire family, it's $1,535. The county gives you $700, and let's just call it $700 for ease of math. So to insure an entire family is about $800 on that plan. And that doesn't matter if it's 10 kids or 1 kid. If you insure a spouse and children, that's the family rate. So yes, $800 is a lot of money, but if you're insuring your entire family for that, that's really not that much money. So you can choose different plans based on your needs and financial abilities. The county gives the same contribution.
If you go to your primary provider and have a wellness check, is that cost going to be completely covered by the insurance plan?
As long as they bill it out as preventative, it's paid for at 100%.
So how do you tell those idiots to charge it outright?
So one thing, Tim, that sometimes will happen if you go for, let's just say, a checkup with your doctor and you're on some sort of medication and they want to pull your blood for a medication check, they're going to bill that as diagnostic because you're going in there for a medication check versus if you go into the doctor's office and say, hey, you know what? I need to get my yearly blood drawn and see where we're at, make sure I'm healthy. They'll probably bill that out as preventative. But also
it's the same service.
same service, but because they're using the
Bill
blood
differently.
for a medication check, then it's diagnostic. They're looking to find something. Where on the health side of it, oh my God, I forgot to introduce you. I'm so
Oh, it's
sorry.
okay.
That makes me think of Taylor. I jumped right into health insurance, sorry. Versus the health wellness side of it, that is preventative. You're getting those services done as a preventative versus a diagnostic where they're actually looking to find something.
So you can request a preventative health checkup.
Yeah, you'll just want to make sure and specify it. It's preventative. And if they say, well, we need to draw your blood, check your medication, you say, nope, we'll do that in a different appointment. But the other thing is, Tim, keep in mind, we host a free blood draw here every spring. That one for sure is going to be paid as preventative. We pay 100% of that. Also, I think Your county health clinic hosts a blood draw too, don't they?
No.
Or does the hospital host a blood draw?
Yeah, they do that, health fair.
The
It's
hospital,
$35.
but not our public health clinic.
No.
Okay, so even if the hospital hosts one, if they charge $35, you have to pay that $35. You simply just send it to us and we reimburse you at 100%. So if you go to any health fair, because those are preventative, or you come to our health fair that we put on, well, blood draw at this point, those are all preventative as well. And then you can take your results and give them to your doctor. Our new provider that we've had, this will be our second year with our new blood draw, our new phlebotomists. They actually have a sheet where you can have them fax it or email it right to your provider as well. So then you get a copy, as does your provider. And those are all preventative. So yes, to answer your question, anything that's billed as preventative is paid for at 100%. Okay.
Didn't you give us codes or something one year? So when we went to our providers, we could help them in case they had an argument?
Well, we have sheets that we can give you to get reimbursed, like if you go to the hospital health fair, that is easy with the codes that they bill. As far as we can't give a code to a provider and say you need to bill this, that's their billing department. They will bill it out. If you insist that it was preventative and somehow it got billed as diagnostic, what we can do is go back and request notes from that office appointment. That is the only way that we can actually change coding that's billed. So we can't actually give them codes to bill. So on that note, because I was so rude to start with, I apologize, I jumped right in.
Okay.
I want to introduce Taylor. This is Taylor Nordhagen. She is our new wellness coordinator with MACo Healthcare Trust. We're very excited to have her. I know we've talked a lot about wellness in the different counties and what our vision is for wellness, and now we actually have a live, warm body that stays with us. We put her through the tests the first couple of weeks, and she still stayed. So now I say she's
here,
fair game to implement these wellness programs and these wellness visions that we have. So I'll let Taylor talk just a little bit about.
Yeah. So a little about myself. I'm actually from Seattle, and I went to the University of Montana, and I got my degree in community health. So it's health and human performance, specializing in preventative medicine. So we want you to do all your wellness checkups, but we don't want you to ever have an issue to where you need to have to go to the hospital or the doctor. So anything that has to do with wellness, whether it is, you're not getting enough sleep, you're too stressed, you need to eat better, you need to exercise, time management, anything with wellness, I can work with. So on top of that, I also have my personal training certificate and my nutritionist certificate. So I feel like I've been with MACo since November, and so right now I've been just going to all the counties that have our medical plan and kind of seeing what the counties would like from me, and if they don't really have an idea of what they want from wellness, I can then look at what's driving claims in counties and say, okay, maybe there's if diabetes are driving this claim, so I think we should do like a diabetes prevention clinic in that county. Or if because we do the yearly blood draw, if that has really good participation, which another thing I will be doing is hopefully getting participation up, because then I can also look at the blood draw results and say, okay, their cholesterol is higher or their blood pressure is higher, and then work from there. So
I just want to interject, that is not looking at specific individuals.
No.
It's looking at information as a whole. It's scrubbed data, so she doesn't know,
who has what.
Who has what. It's just county data so that she can look at what's trending.
Yeah. Very important. People are like, well, I don't want you to see. I'm like, I will never look at your specific one unless, if we were in a county where someone said, I went to the doctors, they told me I need to meet with a nutritionist because I am pre-diabetic, and I said, okay, well, I can sit down with you and actually figure out what we can do with you personally. So only if someone was to come up to me would I do anything for an individual. So yeah, right now I'm just going around, and I think I only have a few more counties left, so I've just been traveling.
Baptism by fire. Yeah, so we're really excited to have Taylor. I'm super excited.
Yes, very.
I was the guinea pig. She planned a meal plan for me with her nutritional information and a fitness plan for me that I've been on since December, and we're doing pretty good. I could barely sit up yesterday because my abs were so sore, but I'm like, okay, I can do this. So it's been going good, and it's we've had a few people in counties that have been referred to nutritionists, and for whatever reason, sometimes it's financial obligations, don't go, and now you have that here as another benefit to the healthcare trust. So we're really excited, and we're hoping that as we move forward, Taylor can actually, as she said, design and implement these wellness programs, whether it be a sheriff department versus the road department challenge, and get those man-egos up and competitive, and or whether it's some sort of inner office challenge for those of us that are at desk jobs. So she'll be able to help deliver that and keep track of the whatever she's keeping track of for incentives, and we're hoping to be able to put a lot more money into our wellness program so that not only at a county level can you incentivize, but also from the MACo level that we can put money into incentivizing those programs as well. So we're really excited. Yeah.
Cool.
So back to health insurance. Do you have any questions for me or directions, or is this sort of what you
So we
wanted
kind of
to
all have
hear?
until March to kind of decide and then let you know.
Yeah, so without final rates being set, obviously these aren't true numbers. But once those final rates are set, then I will come back, same type of sheet, where Mineral County can say, okay, well, we want to offer these exact same plans. Maybe you want to add in a high deductible. And then from that point forward, it's just a matter of the county telling me what you're going to do as far as county contributions. Maybe it's a flat dollar amount. Maybe you're going to pick one plan and say, okay, well, we're going to contribute enough to cover this plan plus dental, or this plan only, or whatever it might be. And then from that point forward, I can do all of the open enrollment materials and know what I need to discuss with the employees. And then the other thing that I did want to just share with you to give you a little bit of idea of where we're at, and this is good knowledge for you as employees too. These are always hard conversations to have, because we don't, as an employee, we sit here thinking, oh, these are they're decreasing our benefits, and we don't want to necessarily feel like that. So this is good information for employees as well. I put together just a little bit of a spreadsheet on what different counties currently contribute, or possibly what plan that pays for. So in my counties alone, and keep in mind I cover everything from Beaverhead, which is Dillon, all the way up to Hill County, which is Havre, and everything west. And then Pam takes care of everything east. So my lowest county contribution is $487 or $446. Oh, that's 2013. Hold on. It is $487. $487 in Teton County, which is Choteau, is their county seat. They pay 100% of the basic plan for their employees. That cost is $487. Now you might be saying, why is it different from our basic plan? Remember, those are individual rates based on your claims utilization. Okay, so every county's rates are just a little bit different. But that's what Choteau County pays, Teton County pays is $487, and then my highest is Hill County, except they would be the ones I would throw out because they're just a little different. Hill County contributes $1,161 per employee per month. Astronomically huge. I can give you a little history on that. But if we throw Hill County out, then my highest after that is Beaverhead, and they pay $872 a month, which pays 100% of the RM 1000 plan. And then from there, I've got everything in between. But that's my lowest and that's my highest. Hill County, the reason they are so high, they're new to the trust. They used to be self-insured, meaning that they funded their own health insurance policy. They paid 100% for family premiums. Doesn't matter if you were just insured yourself, they paid 100%, or if you insured you and all 10 of your kids, they paid 100%. They were essentially subsidizing the entire county and the rest of the employers in the entire county. When they were in the red, they looked at joining the healthcare trust. We were able to offer them rates. That $1,162 is not the rate that we came in at. That is not a standard rate tiered rate. That is an extremely family-friendly rate. Hill County chose to significantly weight their employee-only premium to help subsidize the families because they had been paying 100% for the families. They did not want to go with our standard tiers because families would be looking at paying over $1,000 a month for family coverage. So to go from paying 100% to where the employee has to pay $1,000 plus, they didn't want to do that. So they extremely heavily weighted their employee-only costs to ensure a family at Hill County right now only costs $250. Okay. If we look at standard tiers and put them into a standard tiered bracket, which is where Mineral County is at, they'd probably be right around this high 700s, low 800s to insure a single employee. So I like to put them out there because that is a lot that they're paying per employee per month, but we kind of throw them out when we're looking at the average because they're just a little bit different.
They in Oil County? Coal?
No.
You have the railroad about it.
Really?
And ranchers.
Well,
And the railroad is really good insurance too, and none of their employees were on their insurance because it was free at Hill County.
yeah.
So anybody that worked at Hill County, literally they were subsidizing every employer in that town, including the railroad,
Wow.
telephones, everything. And railroad is a really good benefits
School
package.
teachers.
School, yeah, we had, and even though the school paid for it, Hill County's plan was better, so everybody was on Hill County's plan. So, anyways, that's why they had to switch, and that's why I like to talk about them just a little bit, but we are in the process of evening up their scales. So little by little, they're going to take some of that weight out of the employee side and put it towards the families a little bit more. They're at max for mill levies, and additional mills got voted down. So they're, it's the financial part that the three of you have to, have to deal with too. So, and then I've got a lot of counties in the $600 to $700 range. A lot of counties are paying for our most common plan, the basic plan. Cascade County, which is our biggest employer, they pay 100% of the basic plan for their employees. Basic plan is identical no matter what county it's in. It's the same benefits, same plan. That's what Cascade does, is pay 100% of the basic plan. And then if an employee wants a different coverage, they pay the difference. We've got a lot of RM 1500s and a lot of RM 2000s, which you guys are currently paying 100% of the RM 1500, and the RM 2000 would be an easy switch in my opinion. Easy peasy. That saves about $26,500 a year. So again, it depends on budgets and numbers and what you need to do, but that would probably be one of my suggestions would be to stay in that RM family, because I do know that many of your members have struggled with the pharmaceutical side of it. And if you stay in the revised major medical plans, then they still have access to that separate pharmacy plan. And the way that those revised major medical plans work, even if the county decided they were going to pay 100% of the RM 3000, which we do have a county that does that as well. Yes, it has a $3,000 deductible. Yes, it has a $5,000 max out of pocket. But because of the benefit design in that revised major medical, for many of the common uses, we waive deductible. So unless something major was happening or somebody had some major medical issues going where they're needing constant, maybe CAT scans or EKGs or that sort of stuff, then yeah, they're probably going to hit that deductible. But that saves, 48 and change a year, and they still get access to that preferred pharmacy plan, and then the deductible waiverage on a lot of the common uses, which is big. So that would kind of be something that I would look at, and we can walk through that some more once we get final rates and the three of you have had a chance to kind of crunch numbers and see where you guys need to be as well.
So, is the revision or the impending revision of the Affordable Care Act going to affect the rates at all?
Well, I don't think it will affect the rates because remember when the Affordable Care Act was implemented and so many insurance rates skyrocketed and we stayed level? Because our plan is already so rich in benefits, then if they repeal it or change it, that's really not going to affect our plan anyways because we're going to still maintain that rich level of benefits that we had prior to the Affordable Care Act. We don't want to take anything away. It's something we've already had and it's not going to affect our rates at all.
And your rates are basically set on, like you said, cost, how many people get sick, et cetera. It really has nothing to do with the outside world of the exchange.
No, because we're a pool, so our actuary just looks at the claims data for our entire pool. If we add counties, and remember, just because a county wants to join doesn't mean we'll take them. If they're a bunch of sickies, we don't want them because that negatively impacts the rest of our pool. So he looks at the entire pool of our people and then bases rate renewals off of that claims data. And then he looks at each individual county as well so that it can wind down just a little bit more to be a little more fair to some of the counties. If somebody's really a sick county and they're affecting the entire pool, they're going to have just a little bit higher rate renewal than the average. Likewise, if a county is really healthy, they're going to get decreases.
That's good. Because I know a couple of the insurance plans I've been watching around here, they're talking 30% bump.
And so we don't expect any of that. We're having another positive claims year.
That's good.
And we have rate protection in there saying that you'll never get more than 5% over the average of the trust. You're not going to get that anywhere else. And we went to a summit that Monica Lindeen put on this fall. In fact, it was the same time as annual conference down there in Billings. And the average, and this is off the top of my head and reaching back all the way to August or whatever that was, but I want to say Pacific Health Source, their average rate renewal was right around 8%. Montana Health Co-op was slightly lower than that. I want to say maybe 6.7. Blue Cross Blue Shield was like 62% rate increases with Blue Cross Blue Shield. And that was for their small group plans. So that's, I mean, can you imagine getting hit with a 62% rate increase?
Yeah, you gotta have it.
I mean, you have to provide the insurance. So, and then we have counties that have had good claims year in the past couple of years, so they didn't get hit with those rate renewals, and now they're getting hit with this huge rate renewal, and they're coming to us saying, "Hey, we want to join the trust." We have the option to say, "Nope, sorry, we don't want you," because we're going to protect the trust. We want to protect our members. Ultimately, claims utilization and rate renewals affect us as employees. Maybe it doesn't if Mineral County still pays 100%, but even still, if it keeps increasing to the county, eventually we're going to feel that. Whether it be this year or the next year or whatever it might be, employee contributions, rate increases, I mean, it affects us as a whole. So we don't want the sick groups. We want to protect.
So what if you are sick, though? You're not going to drop?
Oh, no, we don't kick anybody out. Once you're in, you're in. We laugh and call it the good old boys club, but once you're in, you're in. But we do have the right to not offer proposals to people or to groups, I should say, that we consider maybe would be detrimental to our entire pool. And we will, our board of directors and our actuary is very good at protecting the trust. Ravalli County, I think we've talked about them in the past. We've declined to quote them for the last 4 years. And they want to come in the trust, but they're running about 102% loss ratio. We don't want them. We can't have that, because that would impact the overall average rate renewal, which impacts everybody. And then, if somebody's getting a bump above the average, well, then it negatively affects everybody.
So does medicine make the difference? Because it used to be the infusions that I do came out of prescription, and now somehow they flipped over to the medical side.
So
I'm on I have a prescription plan through the maker of the drug, so they pay for whatever out of pocket that I have to pay. So I'm lucky that way. But why did that not be a drug when that's actually medical.
So are they billing it then from the hospital side versus the pharmaceutical side?
Must be, because that's the way it's coming out.
That's
now.
what
It's
I'm
not-
wondering, if they switched how they're billing it, because they probably get more money based on the drug company's contribution versus running it through our pharmaceutical. We're probably not gonna pay them as much as the drug company will reimburse them. That would be my guess. So that
So
if-
even on this new drug plan, then, they wouldn't just charge even $100 or $50 for it, because it's like $7,000 per.
So it depends on how they bill it out. If they're billing off of, I'm guessing that's gonna be a specialty drug, so you'd have to pay 30% of that, we'd pay 70%, then you're only gonna pay 30% up to $15.50, and then we pay everything else. But Caremark has negotiated price contracts with the vendors to say, well, you know, Dr. Joe's pharmacy is getting $6,000 for that drug, and Dr. Tom's pharmacy might get $6,200 for that drug. So that is contracts that they have. So I'm guessing they're gonna bill it however they get the most reimbursement back. Which either way sounds like it's good for you if they're picking up the difference. Yeah.
Yeah.
So. All right. Any other questions or comments, thoughts? Lots to chew on. Health insurance is always fun.
Well, we've always, my feelings on it, we've always prided ourselves with working with you guys, and this is, I don't care what anybody says, this is the best insurance I've ever seen.
Well, thank you.
I've got a few, that ain't so great, and my wife has one that's not so hot. Our employees, we compensate them what we can, and we need to keep something in place that's a good quality product that we can afford. And
Right.
that's why we want to review this and keep looking at it and come up with the best plan we can come up with for our employees and for the county also.
Hopefully I've been able to give you a little bit of
Yeah.
information that
Yeah.
can help make those decisions, and I really think you guys are doing the right thing, looking at all the plan options and how they would affect your employees differently, and knowing that even in this room, as Mary shared, there's employees that are taking some high-cost drugs, and
Yeah.
so, yeah, I think that's great to have some employee involvement in that as well.
You bet.
Well, grand. Well, you can always call me if you have more questions as you're talking through things. From the employee side of it, if you have questions, once decisions are made, you're always free to call me as well. And we can walk through during open enrollment, depending on which direction we go and what we do. I always have time to sit down individually with members so we can go through plans and what might be the best option for them, calculate out financials, and just see, how that works.
So then, Taylor, what's your either phone number or email?
Oh, yeah, I have cards.
Do your cost increases always correspond to the fiscal year?
Mineral County is on a July 1st, yes, correspond with fiscal. We do have a few January groups, but most of our counties are all fiscal renewals. And so what we do, Tim, is our actuary for our January groups goes through the whole rating process for our January groups separately from our July groups. Does that answer your question?
I just wanted to know the commissioners would be potential rate increase.
To do what, I'm sorry?
Potential rate increase for the commissioners would be
July 1.
Well, when would we know, you mean?
no.
Oh, you mean when would it
When
change
no,
on
when it would
payroll?
go into effect,
Oh,
that you'd have to write a bigger check to make up.
Oh,
That's all I
1st
wanted
of
to know.
July.
Yeah.
first of July.
Yeah, July 1st. So everything correlates with the fiscal year, yes. So hopefully it's not bigger. I'm hopeful that our rates stay steady. The last 2 years have been zero.
Yeah.
And then I know Mineral County had a small bump a couple of years ago, but I think
Nothing too dramatic since
No.
we've signed on with.
No, so I'm hopeful. That's all we can do is be hopeful. And so far, we've had a couple of weeks where we get a weekly claim batch, so we know what our claims are doing every week. We've had a couple of weeks late fall where we got some larger claim batches, but on average, we've been staying right around the 200,000 to 300,000 a week mark in paying claims, which sounds like a lot,
Yeah.
but that's for our,
Holy cow.
but that's for our entire pool. So I still think we're doing really well. Yeah, so I'm hopeful, and I know that our reserves, because our claims utilization is still performing really good, our reserves are still fully funded, and we still have excess, so I'm confident that depending on where that rate renewal comes in, I'm sure our board is also going to look at putting those excess claims dollars that weren't spent back into the plan by buying those rates down. So we don't ever want to be building these huge pots of money because it's our county's money. So then our board of directors is really good about putting that back in, and if that means buying the rates down, that benefits the counties. So we put it back into the trust.
Did they find a new board member? I seen they were advertising here a while back for.
I think, at last count, I think Joe Briggs will move into an elected position versus he's appointed right now. And then I believe Jerry, I think it's Collins from Garfield County, is going to be the other elected. And then based on the bylaws, that would be, we have to take somebody that's on the MACo board of directors or past presidents. And I think that will make Ron Osberg from Teton County be the next board appointment. So I'm fairly confident to say that those will be, it'll be Ron and Jerry will be the two new commissioners on the board. And that will happen, that will take place officially on January 26th. We have a board meeting in Helena. So, yeah, I think those will be good additions.
Yeah.
And then Midwinter, are you folks coming to Midwinter? Good. So then we'll have our membership meeting at Midwinter as well. I'm hopeful that shortly after Midwinter, I'm going to come back with not only final rates, but also the Verisk reports, which we've gone over before, and those talk about the trending data with each county, and then we can compare it to MACo pool as a whole. So I should have Verisk reports to look at in our next meeting when we also talk about final rates and what have you. So yeah. That'll be the game plan. All right. Well, if there's no other questions. Comments? Okay.
Well, thank you.
Yeah, thank you very much.
Good seeing you. We have to do our resolution stuff.
Yeah, I guess we better do that
Yeah,
quick, huh?
so-
So,
Okay, we did the first one already, right?
yeah, we did now we've got establishing reorganization of the board. This one
That-
we're
We did
assigning
that.
our,
That was. Who did that one?
That was the first one we did.
oh,
when we
Oh,
started
no,
the
we
meeting.
can continue
We gotta
that.
do our board.
I thought we were
Yeah, 'cause
talking-
we know
Oh,
the boards.
yeah, the board
yeah,
we're on.
Yeah, okay.
Okay.
okay, so what's the first one on the list?
Well, you did your appointment of who's.
No, I
Yeah.
mean, which, or are we talking about the boards that we sit upon?
Oh,
Is that where we're at?
yeah.
Do you have the list?
So the
of
resource conservation and development
That's
is
me.
you.
Yep, I'll stay with that.
Okay. The BREDD economic.
I can stay with that.
Okay. And then the union negotiator, county employee drug testing.
I
The
can-
union negotiators.
Anybody else want to take that?
No.
Okay, I'll stay with that.
Okay. And county employee drug testing.
Yeah, that kind of goes with it.
Okay. And then Dwayne, you are the area agency and aging still.
To the mold? Yeah, if somebody else wants it,
Okay.
they haven't kicked me off yet.
What about the
We've talked
juvenile
about it.
detention regional board?
I guess, I've never been to a meeting.
Okay.
Well, nobody's ever called me and said there
Okay.
was a meeting, so.
We are also on the health, or, well, I guess we're all on the health board. You're just the chair, right?
Mhm.
Yeah.
Okay.
Okay. Okay, and Lori, you are currently hospital board,
Yep, I'll say that.
transportation board,
Yep,
local emergency planning,
yep.
weed board.
Can I hand that one off to Roman?
Or
Sure.
would you like-
That way you can write down with Harvey.
Yeah, he primed me on that idea.
Did he?
So, yeah.
I just thought that would be a, you know,
Yeah, I'll go to that one.
I thought that was a different.
that way you and Harvey can write down together.
Okay, what about human resource
Yeah,
council?
I'll stay on that one.
And conservation district?
Yeah.
All right,
Are there any leftovers? That's
no,
it?
that's
We're good on that?
it.
When is that? Well, I'll ask Harvey, but something like the second Tuesday?
It's the first Wednesday of the month that there's not one in February, so your next one will be March 1st.
Okay.
So you have to approve this one?
Hmm?
Or how it works? Do you approve this one, then you go to the next one, or do we do them all and then?
I'll make a motion that we approve the boards that we
Currently
are
set.
currently sitting on,
Second that one.
With the one minor change of
with
each
one
of the
minor
board.
change.
Okay, all in favor of the motion for the situation on county board, say aye.
Aye.
Aye. Now, providing for public participation, establishing regular meeting dates and times of the board. So currently we're on first full week of the month, it's a Thursday and a Friday, and then thereafter every Friday. Is that what we still want to stay with? Any other ideas? Or
Well, we kind of, I don't know, had talked about the Thursday one.
Oh, yeah, but still that day,
Yeah.
maybe making it be a
Make
day
it
instead
Go
of.
back to
Go
the
back to
day,
days.
go back to
I'm
days.
going back to nights as far as
Okay.
now Sunday anyway.
Oh, okay.
That's what
Anyway,
they
go
tell
back
me.
to the Thursday day instead
Day?
of, yeah,
Okay.
instead of
A
at
day.
night, because it doesn't seem to have much participation on Thursday nights, so,
And-
So the first Thursday
of the month
and every Friday.
and every Friday.
Yeah.
I would make a motion to approve that.
I'll second that.
All in favor of the hours established meeting date, say aye.
Aye.
Aye. Okay, Board of Commissioners send the daily rate for payment of costs for use of detention center.
Nothing has changed on that.
Right, I didn't think it probably would. We're at
It's
$65 a day.
$62.50.
Isn't that the same? That's the same as it has been.
Yeah.
It's, there's no changes, just
Okay,
So I'll make a motion that we set the daily rate for payment of cost of use for detention center at $62.50.
I would second that.
all in favor of the $62.50, say aye.
Aye.
Aye. Okay, establish travel meals and lodging rates for 2017. I guess probably just adopt the MACo recommendation.
Yep.
Yep.
Do we know what that is?
Mileage dropped,
It dropped to half a cent.
half a cent, so I think
54 to
53,
53.5.
53 and a half, I think.
All
and
right.
your out-of-state meals change.
Oh, there we go.
Okay, so I'll move that we establish the travel rates recommended by MACo for meals, lodging, etc.
I would second that.
All in favor of the motion, say aye.
Aye.
Aye. Now we got set official holiday for calendar year. And did MACo send out the recognized holidays for the year?
Yeah, I think that's where I got this,
Mhm.
was from Rico.
And yeah, I think typically it's 10 a year, except on a presidential election
Yeah,
year, it's
yeah.
11. So okay.
So I'll make a motion that we set the holiday for calendar year 2017 as provided by MACo.
I would second that.
All in favor of the holiday calendar motion, say aye.
Aye.
Establish office hours.
Is that hours or?
Well, this kind of, like what you guys want the office hours to be, I guess. as far
Our
as-
office hours or?
Nope, my office
Her office
hours.
hours.
Oh, your office
Yeah,
hours.
but then also, like what times and dates maybe you guys are wanting to be in the office as well. But
Well,
that's just,
yeah,
I mean, that's just
yeah.
kind of,
Whatever.
yeah, and we can discuss it maybe and
So,
revisit, but this is just
So-
a topic.
since you're kind of in the office with what's Licorice's real name? Nicole. I wonder if we can kind of blend that office. I mean, it's either gonna be you or her or us.
And just set the date of, or the time
I
from
mean,
8
is
to
she
5.
okay with, if you're not there, let's say it's a day that you were in from 9 to 1, now it's 2:30, someone comes in, is she willing to take a note or provide a phone number or pass on information?
I believe so.
Do you guys think we can kind of use that
Yeah.
office
Well,
as our
And
office?
I mean, it's mutual too, so if she needs to go somewhere in the night.
Yeah.
Mhm.
You know, so.
So, yeah, so if someone's, and if there's a day that you and her are both going to the doctor, then can you text
Well,
us so that
yeah,
we can?
so that we-
So we should be able to say that that office is open 9 to 5. or
8 to 5.
8 to 5
Monday through Friday.
for inquiries, business, information.
Because there'll always be somebody in there to.
All right.
If not, would you refer them to Tim?
Yeah. That's a good idea.
Tim Mechanic, they're always
Yep.
reliable. All right, so I'll move that we have the commissioner's office jointly with, what do we call?
The administrative office and finance office.
Yeah, the administrative shall, which is the face of the commissioners, will always be open 8 to 5 on regular business days.
I'll second that.
Yeah.
All right, all in favor, say aye.
I,
Hey.
And then we got scratches through the rest, so I guess we're done.
We're done.
Before we get going, allow more people, we should have our new county attorney step up by the flag and
yeah,
swear.
I'll get out of the way.
So for those of you that don't know, this is Ellen, our new county attorney, and we have George is our DES. And you know Tim Reed.
Disaster master.
No, no, and I haven't met George yet. Okay.
Oh.
He's in charge of all disasters.
Yeah.
Calls most of them.
Come up to my office.
And Tim Reed is our planner and our sanitary.
Oh, hi. How you doing? I've heard good things.
Uh-oh.
Yes, I have.
Really?
No,
I can't lie
to.
before I get sworn. Oh, actually, I can lie before I get sworn in.
Yeah.
Yeah.
And Ronnie Phillips is the Sheriff's Office dispatch head administrator over there.
Hi.
Hi.
And you probably already know the Honorable Judge Dale Magone.
Yes.
We're about to swear Ellen in, but first we're going around the table letting her know who these characters are watching.
Okay.
And Peggy Stevens is our.
Yeah.
Well, you want to sit down? You can stand up.
Oh,
I'm introducing you and you sit down. That's
Peggy
kind of
Stevens, Monroe County Health Department.
Hi.
And then you know Mary Arnell, our treasurer.
Hello.
Stacy Hayes, our clerk and recorder.
Oh, hello. Okay, yes, we did meet, I think. Okay, right? Mm-hmm.
And you know Lori, and then you know this lady.
Yes, I do. I think I'm going to get to know her well. Right across the hall.
Are you here now?
Yes, yes. As of yesterday. So,
Okay.
do you want me to stand over here?
Yeah, sure.
Okay.
All right. So, okay, raise your right hand and repeat after me. I do solemnly swear that I will support, protect, and defend the Constitution of the United States.
All at once?
Okay. I do solemnly swear that I will support,
I do solemnly swear that I will support,
protect, and defend the Constitution of the United States and the state of Montana.
protect, and defend the United States Constitution and the Constitution of the state of Montana.
And I will discharge the duties of my office with fidelity.
And I will discharge the duties of my office with fidelity.
So help me God.
So help me God.
Very good. Ladies and gentlemen, our Ellen Donahue, our new county attorney.
Pretty emotional.
Welcome
And
aboard.
then
Thank
here-
you.
And then here, Ellen, you can sign
Oh,
on that line.
all right, thank you. Welcome aboard. Thank you.
That was my main question.
It's official.
Yes. No turning back now. And I mean that for you guys.
She has this sultry, sexy voice, doesn't she?
Sounds like I need to clear my throat.
That's not what I was thinking.
All right, well, every month we have a department director meeting. We just kind of go around the table and see what's happening in everybody's world, and we sometimes will update you and let you know what's going on in our world. And so that's kind of what we try to get together for, little updates and see how things are going with everybody. And George Gupton, what's new in the DES world?
Oh, not very much. Yesterday had the LEPC meeting, the Local Emergency Planning Committee meeting. A good time was had by all. I went over to the health department yesterday and worked with them on their gap analysis, another of those reporting things that the state demands of us now and then. I'll be attending a District 1 meeting, District 1 for disaster and emergency services all of the western end of the state. And we will have our district meeting the 31st. DES conference call that the state puts on Wednesday this coming week. I'll meet Superior Town Council with Mayor Runny this coming week, and we're expecting freezing rain, which if it freezes too much on the highway, I may not make that, but I'll try to. The weather forecast is for warming up and possible rain, I think Monday and Tuesday. And with the ground being as frozen as it is, that would make a skating rink all the way from Lookout past Missoula probably. One thing we learned last night, you've probably seen a lot of, I've seen a lot of whole brand new oil cans sitting on the railroad out here. They're parking a lot of stuff, I guess, because Burlington Northern doesn't have enough crews to keep their trains running, and Rail Link is still got record high amounts of traffic. He said they had their best year ever last year, and it's still growing. They're running every train they possibly can up and down the tracks, and they're trying to be careful about it.
So what are they leaving along the tracks?
Well, I don't know, this morning I know, and yesterday I noticed a brand new oil tankers.
Oh, on the side?
I call them oil cans.
Oh, okay. I thought
but huge, brand spanking new ones. They're on the crossing just this side of Lozo.
Mm-hmm.
There's some at Riker too.
Yeah, and they're all over the place. I don't know if they're full.
So they're parking them. Okay, I thought you meant they were.
Some of them they're parking, and some of them are just waiting for a slot to get down the tracks. I think they are having trouble squeezing in all the traffic, I guess. I hope they manage to keep them squeezed in without it. The Weather Service hydrologist keeps warning us of possible flooding from ice jams, and apparently up north around Libya and everything, they are having some problems with the small streams. The creeks and stuff are building up ice jams. We haven't historically had much problem with that, and I hope that continues. There will be a presentation on April 24th that we might be interested in. I'll do some more research on it. It's the era of mega fires, which everybody's familiar with fire here, and we're having more of these humongous ones. My primary question for today was, do we have a county attorney? And I just got answered. I may have to talk to you someday soon. I'll wait and see if they get it all put together, but St. Regis Fire is having trouble with one trucking company that says no, they're not going to pay for the mess they made, and their insurance company says no, they're not insured, although he had an insurance card in the truck and everything. But apparently it's one of those companies that runs about 5 or 6 trucks on one insurance policy by changing them every day and stuff. They're being uncooperative. I told Jerry to give it a week or so, keep hounding them, and if they don't do something, let us know, and we'll see what we can do.
Okay.
Would they leak a bunch of oil, or what was their?
I'm not sure how much this one leaked. I think this one was mostly motor oil and stuff, and it was leaking on the road surface, so that it had to be cleaned up pretty quick before they could resume traffic through there. It was one of those. There were 2 of them right close together up there here a couple weeks ago, 3 weeks ago.
Mile marker
24.
Oh.
And one of them just leaked a whole bunch of motor oil and antifreeze on the travel part of the road, which they had to clean up pretty quickly. The other one leaked a lot of diesel in the median, which won't get to the water, and they marked it real carefully for DEQ will make them get a cleanup crew in there next year to dig that up, clean it up. But other than that, I haven't gotten called on too many accidents. They've had crashes here and there, but none that really, no real hazmat spills or anything, so we're pretty good. So, no disasters. I took most of last month off. I don't think anybody knows that. I was gone most of the month.
We noticed, George.
Managed to totally wreck my back. It's almost healed up. If that one rib knits back together a little better, I'll be in good shape again.
Oh, Mr. McGowan in Justice Court.
Well, first of all, I just want to welcome Ellen Donahue. I'm looking forward to working with you. Hopefully things will get back to normal and run smoothly again.
Thanks, me too.
Yeah, I hope you enjoy it here. Well, year-end numbers are down some from last year. There's been a lot of turnover, I think, in law enforcement and what have you, so mainly traffic citations are off, but a lot of the criminals still are staying busy with that. Had 26 search warrants last year, and those citations a little over 1,300. They were around 2,000 last year. Civil cases, 125. Drug offenses seem to be staying up, DUIs, that type of thing. But I think most of it's dropped off as just maybe some of the speeding citations, things like that. We had some cert students. They didn't work out very well, so we're probably going to do away with them. They ended up causing more work than they helped, misfiling things and kind of messing things up, so we're not going to have them anymore. They've had cert students in the past that have worked out real well. Had some that went through and cleaned out the vault and organized it. And we're going to have to clean out the vault more. I've been talking to Kathleen, and we need to get that, a lot of shredding and what have you done, and get rid of old stuff that's in there that doesn't need to be there. So we just need to coordinate that. People have been taking turns being sick. There's been a lot of that going around. I think we're on about the third round of it, but hopefully that'll clear up. But luckily, it's been kind of slow in December, so it really didn't cause much of a problem. Just staying busy and things are going along.
So Dale, it kind of depends week by week what board meetings or what I got going, Helena or MACo, but what I thought maybe I might next week come in for a day and maybe in the morning help you and maybe in the afternoon help Mary, but what day is Cindy there? Because then that way Cindy could help teach me what the CERT kids were doing.
She's on Monday, Tuesday, and Wednesday.
Monday, Tuesday, Wednesday.
Yeah.
Okay.
Yeah, we really got the files cleaned out. I mean, they're about half full now. That when I first took over, we couldn't get a file out hardly, much less put another one in. They're about half full now. There's a lot of old things in there that 10-year-old warrants and what have you, and they've been really good about going through all that, cleaning it out. But yeah,
Monday, Tuesday, or Wednesday would be good.
Yeah.
Okay.
Yeah, appreciate that.
Anything else going on?
Yep, that's all I got.
That's it? All right. Mr. Tim Reed, or is it Tim Reed? Tim Reed. All depends on the inflection.
Finished the year with about 31 sewer permits, and got most of them put in the ground, only a couple of them that didn't actually get in the ground, so that was a fairly good increase on that part of it. We beat it up with the state for the computer system and finally got it to crank out that I did 100% of the inspections for food, trailer court, public accommodation, and pools. Report that. I like to be one of the very few 100% clubs that go across the state, so I'm going to see if we can get our money out of it and stuff. So. Subdivisions are pending, but nothing seems to be coming in, so anticipate there may be a planning board meeting in February, but I'm still not sure. I haven't received a full application yet, so, but there's 2 pending out there that we're going to
So, Tim, did you say that for the entire year of 2016, we only had 1 or 2 sewer permits?
32.
Oh, 32.
31 to
Oh.
32.
All right, that's better.
Yes. Working on the state line, we've kind of stopped again. I don't know if Billings is stymied by snow and cold and everything, but they don't seem to answer. We've had to set up whatever you call it with DIS, where we can exchange information, because they can't get big files, and we can't send big files, whatever, anything that I have to send them, we have to drop it in this zip box, and then they have to get it out and stuff. But I'm really gonna try to push on them, because the final EIS came out for Lookout with the draft record of decision. And I'm just so convinced that that new 3,000 square foot building is in Mineral County, and that the line was jury rigged and never surveyed, so put that in the other shed back in, we can potentially look at $3,000 to $4,000 worth of taxes if we can get that stuff back in our side of the line and stuff, so keep pursuing it, moving ever so slow. Zinke's off our list of no help person, because he's technically being appointed to a cabinet position, so therefore he cannot work on projects for Mineral County. It surprised me a little bit. Whatever. Not getting a lot of help there. I have about 20, 30, 40, 50 cases for the county attorney, if she was ever want to see the light of day and talk about cases in the county that should be enforced upon and stuff in one way, shape, or form. She could advise me that that's not a good, wise policy to enforce those things. Just go on our happy merry way, or we could try to do something about a few of these things out there that are kind of pending. Just a lot of age-old complaints and stuff that don't go away, and probably have at least 15 to 20 sewer installations without permits that should be addressed, I think. So. EPA, DEQ, they worked up till December 23rd in Flat Creek. They received how to build a fire lessons from Jim Schultz, so it was interesting. So, anybody that had a bunch of used oil and diesel and everything else like that, they torched off things up there like you couldn't believe. But they had some really towering infernos. I saw it one day up there. I mean, that sucker was shooting 30 feet into the air, and then the guy comes over with the clam and starts dumping green stuff on it, and it's like, man, if you could figure out how to smoke something, guys, you'd be in business.
I could have brought him some flavors to put in.
Yeah.
Make it burn better.
Got an associated complaint, found out where they were dumping all their waste in a private container system, and he was taking exception with it, so we'll try to get that straightened out. Don't know if we'll really come back and start work date in spring and stuff. I think with the snow, it's gonna be a little bit later than we anticipated, think, but we'll be back in the spring. I don't know whether to put on a 40-hour course for the locals. They won't tell me if they're gonna hire anybody local. A few people that they did hire, I think the majority of them have taken the 40-hour course, so. But we had about 3-4 local flaggers that got on the job, and one driver or something. Local fuel contract was good, because the Cenex fuel truck went up there every other day when they were digging the hole up there. They were punching the fuel through those 2 scrapers up there. It was kind of interesting to watch. So, anyway, that'll be all coming up this spring, and see what they're going to tear up and do and say and things. Not much else than that. I haven't got any pre-notice that we're going to have some wacky doodle events up on the west end this year, but I'm sure that we will, so see how that goes. And then I still think that I should be pressing either for counseling or extra pay to go to the Elton Town Council, because staying, have been, always will be weird. Really
Please
mess
let me
with
know
your
if you have
mind
to
a
do
little
that
bit.
for the
Huh?
Superior. So please let me know if you have to do that for Superior.
Yeah, and then Superior hasn't been quite that way. So.
You live a sheltered life, Tim. You gotta get out more.
No, I agree. I
Say
attended
not
the
much
last one
consolation,
too.
but I've heard that about them for 18 years.
I've been
Don't
to
expect
one,
it to change.
and it's wow. It's wow.
So that's an interesting question for you then, because they contracted with Mineral County for their legal services.
Mhm.
Has anything come up on the radar screen for that? or-
I got a payment yesterday, if that's what you mean.
Yeah, they
Okay.
approved the payment for it at this last meeting.
Not in day two.
They approved the payment, but didn't have to tell Ellen that she's gonna be their attorney representative. So they have council meetings on the first Tuesday of the month at 7:00. So next February, whatever, so at 7:00 they would have that.
February 7th, yeah.
And the mayor may or may not be there, and it's sort of a wild guess every month as to how many council people they have.
Well, we got a new one.
Yeah, a warm body finally walked in and said, yeah, I'll do that. Okay, you're appointed.
We love their protocol. Somebody walks in and they go, you want to be on the council? Oh, I guess so. Okay, we're on the council.
I'm just looking for a place to park.
Yeah. Was headed for the bar.
Open the wrong
This is
door.
the bar.
That's all that I need to say today.
Who's the mayor down there now?
Josh Acker.
Yeah. He didn't make the last one.
Johansson's not on there.
No.
He hasn't been on there for years.
3 times and you're out.
So Ronnie, before we let you get going, could you make a note? We got, over by the library, we have a dumpster, and there's somebody living in a little camper pole trailer over there. And we don't even really need to look through the garbage to find their name on it, because we have an eyewitness. They've been dumping garbage in the county. We didn't know if maybe a deputy could give them a polite, hey, that could be a theft of service charge if you continue to dump your garbage in our container and fill it up.
Where's the trailer?
It's over by the library.
By the library.
On whose property?
County.
Those 2,
Oh.
3 trailer spaces right there as you walk this way.
Oh.
Right on the corner.
It's
that-
in, what's his name, trailer court?
No, it's not a trailer court, I don't think. It's those,
Sugar Creek? What are you talking about?
right over
Right there
by my
behind the
office.
library.
When you walk over to my office, there's a
There's
trailer on
three
the.
trailers. That's a trailer court.
Okay, trailer court then, yeah. Travel trailer in the trailer court,
So
yeah.
if the guys are dumping garbage in there, tell me and I will jump their case.
Oh, okay, I'll tell you then.
All right.
I don't know their names or anything, I don't even know what.
The sanitation, the
We
sheriff's
just got the
office, and the mayor.
Is it
Okay.
right there by Pete's?
Yeah.
Pete Vidges?
Yeah.
It would be backs
This
up to
side.
Pete's, yeah.
Yeah.
It's on this street
But
from Pete's.
it's that newest trailer that moved.
Yeah, where
in
they-
that
They
big
said it was
space.
a camper
They
trailer.
pulled that old
is what
trailer
they
out
said.
and then the space right next to the trailer on the corner, they put a camper trailer in.
Where there was,
Anyway, whoever's living in the
suicide
camper
Yeah,
trailer
yeah.
is putting their garbage in the county dumpster.
Good. I'll get hold of Mr. Sugar Creek, give him a call.
Thank you so much.
Good job, Tim.
You are welcome.
Okay, so yeah, rights or Roni, what's new with the S, other than the broken water line?
Oh, yeah, that just happened. Tom wanted me to let you know that the town's car is up and running. It's out and about. That one was assigned to Boone. Something with the cage, and some of our guys are too big for how the back of the car is. If they have a bucket seat in the back, they can move the seat back farther. If they have the little half cages, you can't. I'm not quite sure how all that works. But anyway, the town's car is up and running. AJ's car, 54-3 car, is in the shop getting repairs done. We're up to a full crew, hoping this next week is they're on their own. I'm keeping my fingers crossed for just phone calls and not have to come in. Detention staff is up full crew. Deputies are up full crew. Some are still in training, some are not. We've got one officer going to the academy Sunday. He leaves for the academy on Sunday. What else? I think that's it. Hoping to take some time off here soon, because I need it.
Oh, yeah, your dispatch up to manpower, is that the one you're talking about getting off training, or?
Yes,
Okay.
yeah. I've got one gal that's now on swings by herself. I still get phone calls, which, okay, call me, I'm good with that. I'm working with the last one this week, and she hopefully will be on her own on Monday. And we'll see how it goes. We might have some little bit here and there that we need to do, refresher stuff, but I think we'll be good to go. And I do have a bunch of overtime, or not overtime, but annual leave, just so you know that I am trying to use it before the end of March.
Mhm.
But I don't know that it will all get used. I've got about 136 over what I'm supposed to have. And I really would not like to lose it. Do you need me to draft up a letter or something so I don't lose my annual leave?
Yeah, there's that form for, if Tom says that even though they're trying to let you use it by that, then there can be an extension.
Yeah.
Ask for, and we could grant the extension.
Okay, I can do that.
All right. Peggy, what's new with you?
Well, a lot, but I thought we created these forms to give to you guys monthly. It's a kind of a report of what we've been doing in each grants. Since this is, and I'm sorry my voice is really hoarse. Since this is the first one we have given you, I requested that we provided information since July to current. So the next reports won't be as long. They'll be a little more condensed, but I just thought I'd run through it really quickly if you don't mind. So we'll start with communicable disease and dog bites section. The staff, as you can see, keeps up to date with all of the situations coming along as far as communicable diseases. One of the ones we're watching is Zika, the Zika virus, and I think you guys have heard that over the TV. And really the only reports we've had on that is people traveling to countries that are known to have the Zika virus.
Like Costa
coming
Rica?
back. Yeah, that too.
We could cancel vacation.
But anyways, I'm suspecting we're gonna start seeing that float in to, it's already been here associated in Florida and that, but it's coming our way. The report that you see here regarding communicable disease, I've given those numbers to you. They've changed a little bit. We do have positive influenza, 4 cases right now. Our norovirus seems to be settling down. I haven't had any new cases reported since the first ones we got several weeks ago. Let's go on to immunizations and then the immunization action plan. Total immunizations that were given since July till the end of December was 391. We're limiting access availability to immunizations due to limited staffing, so we're kind of having difficulty keeping that going because of the staffing available. We held community flu shots, and we administered about 284 influenza vaccinations to the Mineral County residents. We still have influenza shots available, so if you know of anybody that hasn't gotten their influenza shot yet, just have them give us a call. There's a correction here about renewing the IEP grant. We did renew the IEP grant and it was signed by you. We will currently get $4,100 for this current fiscal year. We're working on reconciling our vaccine supply and looking at maintaining adequate supply of vaccines and staffing, and then of course we're looking at appropriate documentation too for the new hire. On to administration and billing. We hired the administrative assistant, so thank you guys for all of that. She has agreed to do the billing with the increased hours that would equal to the $3,000 that was allocated this budget year. She will also be getting hours out of the Montana Healthy Families grant that would equal her to 40 hours a week. With the increased hours that she got for the billing, and then also the increased hours she will be getting from the Healthy Montana Families to assist us with that billing of that grant. So on to public health emergencies on the next page. You can see that Louise has been very busy updating plans and all of the deliverables regarding the mandates for that grant. As George said, they were working together regarding the gap survey. It's a pretty complicated grant. You can see the list. I don't want to read through that. It'll take quite a while. I'll let you guys just visit that. If you have any questions on any of those, just let me know. It's mostly updating and reviewing policy and procedures. And on to the Montana Tobacco Prevention Grant, and this is a grant that Barb Jasper does. And of course, thank you for passing tobacco free for our county properties. And she, I believe, is getting all of that taken care of and processed. And also any flyers or banners that are needing to be posted, she's getting that also. She's working on Town of Alberton and Superior presentation for parks to be tobacco free too, which is in the works. As I said, you can read most of that. She's working on GASCO, which is an activity for tobacco prevention, and then also Kick Butt Day. She's worked on that. She also does monthly meetings in the high schools with kids to help educate and process tobacco prevention programs. She's pretty busy with that, as you can see. So we go on to maternal, infant, early childhood home visiting. That's the McVie grants that Jen Donovan is head of, and also we have April and Laura, who is a part of that program. The McVie funding will end, as you guys know, on 12/31/16, and we applied for a new grant, which will be called Montana Healthy Families, and we will receive $255,908 for that, which is will help fund home visiting for that program for needy families. And we are currently visiting 31 children in Mineral County. We have the capacity to visit up to 40, so any referrals that you guys would like us to have, please contact Jen or April, because we do have some openings there. Maternal Child Health Grant. This year's project, we're focusing on increasing the percentages of children 19 to 35 months who have received the full schedule of appropriate age-appropriate immunization, including diphtheria, tetanus, pertussis, polio, measles, mumps, rubella, Haemophilus influenza type B, hepatitis B, varicella, and pneumococcal, as well as the increasing the percent of 13 to 17-year-olds who have received age-appropriate adolescent immunizations, including diphtheria, tetanus, pertussis, meningococcal, and human papillomavirus. To accomplish these goals, we're actually asking the administrative assistant to help us with assessing charts, sending reminders and schedules, scheduling appointments, and we're working with the state MTRAX program to help us to review the recalls within their system. So on to fetal infant child maternal mortality review, FICMR. The final reports for that has been sent in, and for all of the deaths that occurred in 2015, regular reviewing the state provide a death report checking, and they check. The state sends us a report every month regarding infant, child, maternal deaths that occurred within our county, and we review those. Best Beginnings Grant. They are very busy with this. I'm sure you guys can read through this. They're expanding their Healthy Communities Coalition. They are doing a lot of good stuff. I don't want to read every single thing, but you can see the work that they're doing on those grants and on that grant and how it best serves the community. Public Health Systems Improvement Grant. This is the one that worked on the strategic plan, and I believe Amy came and spoke with you about that through the Board of Health, as well as I've talked to you a little bit about that through here at the Commissioners meeting. The importance of that strategic plan and the CHIP and the CHA in regards to accreditation for our health department and future funding. So I'm not going to read all of that. And then with the school contracts that we are doing, we do have an RN president in the Allenton School 1 day per week, St. Regis School 1 day per week, and Superior School 3.5 days per week. They have ongoing school nursing work that addresses management of high-risk kids with illnesses, managing medications for those kids, infection control measures in any outbreaks that happen in the school, especially the norovirus in one of the schools, and as well as current influenza that's been going around. So they do a lot of school nursing services to that population, such as height, weight, scoliosis, health consultations. So it's a multifaceted work area that the nurses are providing services to the school population. The next is Women, Infant, and Children Supplemental Nutritional Program, which is called WIC. This is what Jen Donovan has been doing, and she's been trying to get up to speed. She's currently new at this since Sue retired in July, and there are currently 20 families that she serves. She's looking at trying to complete the educational requirements and training and reporting mandates by the state. And last but not least, the Montana Public Health Association is what we are currently a part of as public health nurses. One of our nurses is the public health nurse section leader of MPHA. She attended an annual meeting in Bozeman and is currently working on a statewide orientation process for new public health employees to best use available resources to streamline training, which will decrease costs and improve effectiveness. Then also we're looking at through MPHA, there's a program that offers a student to come and help local health departments in projects that they wish to get started or complete, and we've requested that for a student to work on one of our projects, which is accreditation, and so hopefully we get some free labor to help us with that. And that's it. Sorry for the length.
That's all you did?
That's all we did.
All right. Mo in the treasurer's office.
So when we had the meeting, I think it was your Thursday night meeting a while back, or whenever we were discussing trying to get like an impact statement or something for the Forest Service. There wasn't real helpful. As much as I can find out is that Plum Creek is being charged $1.48 an acre, and I don't know how many acres the Forest Service has to be able to calculate that. So. But if
642,000, I can get you the exact number.
Okay, so then we can go forward on that.
With our little tax bill for them.
Yeah.
Good. I was going to ask about that, but you beat me to it.
Then also on January 11th, it's going to be 6 months that Shirley's been in the office, and I don't know if I need to make a meeting to be able to go over a raise for her. Besides that, I don't really have anything. Everything's moving along.
I got a question, Mary. One of those meetings, we talked about checking in to see about equipment parked in Mineral County as of the first of the year. Are they taxed for that equipment? Who does?
For like special mobiles?
No,
Checks
no,
that.
equipment. Like say construction equipment.
Be like Rayline's equipment out here and
EPA.
stuff like
Should
that.
be what's there from January 1st.
So if they're in the county January, and who
Who checks on that?
checks
That
on
would
them?
be Polly.
So she would be at the Department of Revenue to call her, and
Right.
she would be the one with.
The problem with that, especially like Riverside, is that they still have so many pits and so many they have things that are mobile, whether they're sitting out here or not, they're still mobile. So you gotta do a pretty interesting determination to figure out something between permanent and something that's part of their operation that one's going to get.
What about like DPA? Would that be the same thing, that equipment they have?
For the brick and stuff like that. I don't know, they're brought all their belly dumps in and doing all those things. I don't know if you saw any licenses from that or.
Not yet. But if they're already in Montana, then they could come do it any time during the year. Not like it used to be, when it used to be the big equipment used to be from January through February 15th, they'd all renew. But now it's when they brought it into Montana is when it's licensed each year, unless it's a special mobile, and that goes from January to December.
But like they had their scrapers and all their stuff up the creek up there, and I don't know if those units are not loaded with you. Unless they have a license plate on them, then it doesn't apply, right?
Right.
They'd have a license plate on them if they travel down the road, but if it's just equipment, then there's a way for you to tax them for their equipment. I mean, even when those out-of-state highway guys work on the bridges, they have all those little all those little sanders and everything they're supposed to. That's why it's always a problem when there's a bid, because somebody from Oregon's not paying high property
But
taxes.
if this is an outfit from Belgrade,
Oh.
or Montana.
Mhm. So they're paying, they might be paying for all that property out of their own county then.
Yeah, they are.
The only time we'd be able to cash in on it is if they were from out of state.
That's all I have.
Okay, thank you.
Stacy, what's new with you?
Dealing with some medical stuff, not gonna elaborate, but, office is plugging along. Tim alluded to the Zinke appointment. So heads up that we may be in, well, most likely are in for another federal election. If it happens before the end of June, it's gonna go on this fiscal year, obviously, which the last federal election kind of shot my budget. So we'll have to deal with that. If it's after, July 1st, then obviously we can adjust whatever, but at the moment, it would have to be a polling place election, just like the November election, because legislature won't approve mail ballot for federal elections. They're trying, between the Secretary of State's office and the Clerk and Recorder Association, to get legislation this year to approve, since it's only one race, they're trying to get them to approve just this one to be mail ballot, because
I don't know why they don't do them all like that.
I know,
All you
it's
gotta do is look
ridiculous.
at the number of absentee ballots. that
Well,
are
and
mailed
what's
out.
funny is, if you look at the list of legislators that vote no on mail ballot bills, they're all on the absentee list. So, I mean, it's really stupid. So, it's not okay for the state, but it's okay for them, So anyway, that's the biggest looming thing. We're in the middle of filing for all the districts. So there's the resort board, the fire districts, the sewer district, I said resort, hospital, and then the schools fall at the same time, so we could have I think I counted up to like 7 different elections going on. The good news there is that half the time, not enough people apply for the little districts, but the school is talking about running a bond. If they do that, then I'll do all the absentee part for them, which is fairly standard. Other than that, just trying to going through my retention schedules for, the old records and stuff, because they have to be, every tiny little thing from a sticky note to a, poll book has timelines of when you can finally get rid of them, and then there's a process. You have to put in a request form, and so I'm trying to figure out where everything is and hopefully get some of the vault cleaned out so we can start moving stuff from upstairs to downstairs, because we're running out of room everywhere. But really, just this is usually our quiet time, and it's really not all that quiet. And that's, but while all of you are here, when you make phone calls to, the biggest one is probably Justice Court. When you call somebody, if you would leave a message for them, if you would leave your phone number, I'm sure sometimes you do, but the caller ID, when it goes out, it only shows our phone number. So we spend probably 90% of the day with people, you answer the phone, they're like, somebody called me from this number. Well, no, do you know anybody in the county that might have tried to call you? Because it could be anybody. And so that's, it's not life or death or anything, but it would be nice to not have to run for the phone when they don't even know who called them. So other than that, just plugging away.
All right. And Kevin, you weren't here, but if you haven't formally met Ellen Donahue, our county attorney, Kevin Chamberlain.
Nice to meet you, Ellen.
Nice to meet you.
He doesn't really work in the courthouse. He works over at a satellite office there. What do we call that? The extension. And his left-hand man there is David Brink, the weed man.
Oh,
We're gonna have a lot of time to meet.
Okay.
We're gonna have a very busy spring, I foresee.
Get in line behind Tim.
we might trump him. Who knows?
Uh-oh.
So what's new in your office, Mr. Chamberlain?
Well, same old stuff. Working with 3 business/entrepreneurs. 2 of them considering potential loan fund, which I rely on your office to help us with our contracts and all that stuff. 2 of them are expansions and one's a new startup. The other one might be classed as a new startup. Mineral County Resource Coalition is going very strong. Was able to garner about 10,000 with another possible 10 in the wings if we need it. Got 5 to help the commissioners be able to travel to forested counties and Forest Service related, county related workshop stuff, so they don't have to choose between MACo and representing the county at these other issues. And then another 5,000 for basic operations of the Mineral County Resource Coalition. Working on a couple other grants right now, but they're very preliminary. 4-H, Dave will talk more about that. But it's not a quiet time, but it's not nuts either. So.
And Mr. Weedman.
I guess I'll segue with the extension side of things. Happy 12th night. Lori already got hers.
Oh.
Little pocket 17,
All right.
18
All right.
calendars.
Good.
4-H wise, it's been just over a year since Emily came on board, and she's working out great in the office. She's getting familiar with the many different facets of working in an extension office, and I think from the 4-H side, she's probably ahead as far as getting enrollments and leaders to turn in the necessary forms that we're required to keep. Our enrollment is up slightly for youth, and we're trying to get some volunteer adult leaders to work with some of them. They're looking at new projects all the time, and sometimes it's just a struggle for us to find volunteers that are willing to put in the time to work with them, and then also be screened and checked through the university, which is always a bit of a challenge. So it's good that the kids are interested, and it's great that we have the number of adult volunteers that we do. So we try to keep that quality up there. We just finished and submitted our annual report to Extension, and at some point we'll be bringing copies of that around for you. I think we had mentioned it before, but we do have a new regional department head for the western side of the state, and that is Dan Lucas, who was formerly an agent out of Granite County. So at some point this spring, he'll probably be making a tour and coming in to meet with you, the three of you, either in a special session or something like this. We'll be scheduling that. I don't think there's anything else. Extension side, switching hats over to the weed side. I guess Tim wasn't able to make our meeting Wednesday night. Lori said there was nothing really new to bring up from MACo, so we're just going to kind of leave that until we hear from MACo. I'm taking off next week to go to the Montana Weed Control Association annual conference, and we will be meeting there to discuss some of the issues that will be coming up probably in the spring. We still have an outstanding bill that has not been paid by a state agency, and I'm discussing with a Department of Ag lawyer about if we just flip that over to them or if we continue to try and seek that. So now that we have a county attorney again, I'll be meeting with you and bringing you up to speed on that probably later in January. What you do when state agencies don't pay their bills. You can't exactly assess their taxes, but perhaps through state law you actually can. So hence the meeting with Department of Ag lawyers and whatnot. Both of our legislators, Denley and Gender Fielder, are very interested. They are also apprised of the situation and have been very supportive. So that's good to hear. There's a couple of other state issues that are kind of coming to a head, and like I say, next week we'll be discussing that as a statewide organization and bringing some of that back before your weed board presses the issue anymore legally. So I think as far as I know, we finished out the year very well. All of our equipment's in storage, and haven't checked it with the recent cold weather. I'm hoping that everything is wintered well. Right now I can't get it out if it didn't. So I was looking at the berm over there and thinking I'd be able to cycle the diesel engines over, and I can't even bring them out. So we'll let them go a nice cold winter without cycling them, I guess, and see how that goes. So other than that, things are great.
All right. Ms. Brown.
First, the Supreme Court, the Court Administrator's Office came, updated all of our computers, put a computer on the bench for the judges, tied my telephonic or to my phone to the audio system, spent right around $16,000–$17,000 on the courtroom. So it's just one of those things that the Supreme Court spends that the county doesn't have to. So I just wanted to make you aware that every 3-4 years they upgrade everything, and they've been real good about getting whatever we need in the courtroom done. So the e-filing for Mineral County went into effect on December 20th. It's been mostly going fine, being a pilot with Missoula County and the judges. Is a little bit of a learning curve. Going paperless in the court system seems crazy, but the Supreme Court's been doing it for years. So we're cautiously optimistic, and we will continue to work out any bugs, make it as easy as possible, fix whatever we can so that when it's rolled out to the rest of the counties in the state sometime in a year, it will be seamless and we'll be able to go from there. The judges during court will have their computer, they will have to bring up images of documents that have been scanned in or PDF'd in during court so that they can actually read and review those documents as they go through court. So they will not have their paper files. Right now they still have most of all their paper, but as time goes on they'll have less and less. So it's exciting, I suppose, and you know, Ellen, poor Ellen, she's in and we're just gonna dump everything on her. So, and we can't answer very many questions because it's basically we have only been doing it for 2.5 weeks anyway. So we have all the same questions, which makes it good. I have a bill. Don't.
I didn't say
I know.
that.
I'm just stopping you before you go there.
I was gonna write it on the back of this.
I know you were. I'll Photoshop your picture. We had an involuntary commit not very long ago, as you all know. So this bill is $1,978 and some change. Now, in my budget, left over from the last involuntary commit, I have $1,300. So this is going to be in the minus come next month, but we know that Kathleen doesn't have any choice in this, right? That was an acknowledgement.
Well, I think you're making poor choices in your office.
What?
Joking. How do you control when someone's involuntary?
Well, I don't, because everybody else has more control than I.
I know.
It just ends up in my budget. I'm not quite sure how that happens. But
Could you help make the county saner, maybe, somehow?
Thank you, Kathleen.
$1,400.
I'm not quite sure I can do that.
Why don't you make more cookies?
More cookies?
Make
You
people
think that's going to
happier.
help? More sugar?
More
Great.
sugar.
Great.
I'd
So
be good with that.
You're good.
you might have interactions that are not good for you. So anyway, I'm going to present this bill next month when you get your reports. There's going to be a big old fat minus. I just thought I'd let you know ahead of time. Okay? And going back to what Dale said about the records and our shredding and all that kind of thing, I just have a question. When we did that shredding and we had those bins, are we on a monthly pay schedule or something?
I think we are.
And who pays for that?
That was my question before I started using it.
I mean, I never use it. I don't want it to show up anywhere in my stuff. But I don't know if it's evenly distributed or...
Shredding bill?
I think one of them comes out of the sheriff's budget because we have one of the containers over in our office. So we have
And there's two, there's one in Casey's office and one in Justice Court.
Are you sure it's not the same one?
No, don't you have a bin down in your office?
Mhm.
Yeah.
Like, I loaned that one out to them. That
So,
one,
that's my only question. There's a few piles of things down in the downstairs vault that Mary and I talked about that we thought was gonna be incinerated or taken care of. Which is still just kind of piled there. So, my records, very few of my records ever get destroyed. It's just a perpetual thing. Obviously, I'm not gonna have, since we're going paperless now, the need for boxes and boxes now. But I am gonna need just a little bit more room. Justice Court is getting ready to take care of some of their boxes, but it just brought up the question of how we do the shredding and who pays those bills.
Yeah, I was thinking the same.
So,
I'll have Casey.
Yeah, we'll have to.
Yeah.
Because I was wondering why we couldn't still, like before, and Roy had taken a couple loads of stuff that I had gone through with the retention schedule to Tricon. They had an incinerator. I was wondering why that wasn't, because I thought we didn't have to pay for that. He just loaded it in his truck and took them.
right.
Because I've got more to do, but that's what I was wondering. My
It's just
budget's
gonna
tight
pile.
enough, I can't
Yeah.
see any more coming out of it.
I did talk to Wanda a little bit about that. She said that basically we just need to all get together and figure out what we need to get rid of and get a hold of the shredding company and have them come down one day and do all that. But again, I don't know who pays for that.
Well, I thought when we talked about that before, when we dropped that one for Casey's office, that it was gonna be distributed evenly.
Oh, I don't know. I don't
That's
know
what I
it is.
recall.
I mean, if each
And I
office
don't
that
know
brought.
about Roy taking it down to Tricon. I would think that there would be an issue with,
Well, I just know that my stuff needs to be shredded, you can't just throw it away.
Right.
yeah.
But I thought that, I know that he had done that on a couple of occasions.
Do you have a ton of stuff?
I got a pretty good, and I thought it would
It's a
go
good
and it's
pile.
been there, yeah, but,
They come once a month, so, I mean, in the one that we have back here, there's room if you wanna just dump it in there.
And do
You
you
just
get
put
a
it
bill
in?
for that though?
I have not seen a bill. I've not signed off on a bill, so I don't know how it's being done. I honestly
How
don't.
does it, I can't remember how it comes.
Yeah.
the
I
one
don't
in
know.
our office is, I think we're paying $90 a month for it.
Is that not a combination of the two, maybe?
I don't know,
We'll look at the bill and see how it's.
Yeah, we'll have to.
because the stuff needs to get rid of it. I think it's a danger just to have all that in there,
Yeah.
sitting on the floor and.
You
If it
can't
once a
walk
month,
around
you
in
want
that
Yeah.
vault, there's just piles.
We've got room in there, just dump it in there. I don't
Just to
think-
be able to organize it a little bit, to utilize the space that's there.
Mhm.
I think it's like $30 a month or somewhere around that area. That's
Yeah.
what the cost is.
How big's that bonfire at Flat Creek?
Yeah.
Big enough. There we go.
We could call Mr. Schultz.
Yeah, Schultz is shredding.
Jump right there.
When are you letting that big pile on?
If it don't warm up, we can do it right out here on the lawn.
You can sell it to the CIA.
Yeah.
Have a fire pit.
So is that it, Ms. Blount?
Already shredded, burn it.
Yeah, I think so. I think so.
There you go.
I might think of something later, but yeah.
Now for the new inhabitant on the top floor.
I can be the quickest.
Oh.
Not much to report. Day 2.
Yeah.
So I'm just basically shadowing Christine. And
Uh-huh.
we were in Justice Court yesterday.
Cool.
That went well. We have District Court on Monday, and I think that's Christine's last day.
Mhm.
So that'll be a good chance for me to experience law in motion here. We're going through forms. A lot of the stuff looks very familiar. We do it a little differently from where I'm coming from, but I'll adapt.
Mhm.
Yep. I think it'll
Well,
go
we're
well.
glad you're here.
Yes,
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 we
we are.
Thank you. I'm glad to be here
Yay.
too. And I had just moved in and just got
It's
the
warmer
stuff loaded
here.
off. Yeah, 6 o'clock, 6:30 Wednesday night. Yeah, and trying to get the moving guys Tuesday and Wednesday when it was -14, and we were moving Still trying to pack up the truck at 2:00 in the morning,
Oh.
Wednesday morning, and it was minus
Wow.
22 at the time, so those poor guys.
So you're in permanent digs already, or did you find out where you're staying?
I'm going to be renting the apartment or the house below Cindy and Mark Grimm.
Oh, very good, okay.
Yeah, so got in there and just trying to find clothes that aren't too wrinkled because it's still all in boxes. I found the ironing board was easy.
Mhm.
I just can't find the iron.
So toss them in the dryer.
Yeah, I don't have. They forgot to bring my vent. The movers forgot to, so I can't do laundry either. So that's where I'm going tomorrow. Get the venting thing, so I can do some laundry and yeah. But all is well. It's going well.
All right,
Mhm.
well, good. Well, thanks for being here, even though you
Yes.
didn't have much to report. We like seeing you.
Yep.
Thanks
Good to hear
everybody
from
else
everybody
too
else,
for
yeah.
coming.
Good information.
I guess, do we have any much to report to anybody? What do we got going
Yeah, just,
Is that a trap for you?
yeah.
Yeah, we lured me.
Yeah. Senator Daines' representative came Tuesday to our coalition meeting. Of course, in MACo, which we kind of emphasized how important health
Mhm.
and SRS is to get that
Mhm.
funded, so.
I had lunch and he came and joined me. He wouldn't even let me buy his cup of coffee.
Oh,
Very
really?
rigid about the rules. Well, it could be seen as a bribe, a cup of
Yeah.
coffee. So he insisted on paying his $1.75 and I said,
Good for him.
yeah. I mean, I can see if I bought him a hamburger, but why have two chickens for a cup of coffee? So yeah, and then we're gonna be going to MACo in mid-February.
At our annual conference.
And what else, Dwayne? I guess all of you know I'm officially not working the road anymore, so I still feel like I'm kind of just on
What's that?
Christmas break. Hasn't sunk in that, although I have little, what do you call it, not PTSD or flashbacks, 4 in the morning that the phone is ringing. When
But they
it's
took your car, right?
I just took the car, and they
Yeah.
actually took that phone with that annoying ring that I still have. And I was in a cafe the other day and the phone rang and I,
Yeah, you wonder,
Uh-oh.
is that me?
yeah. But, so yeah, it's officially done. And their Highway Patrol's planning a retirement party for me in St. Regis at the Visitor Center on the 20th of January. And so anybody, all are welcome if they want. Sean Smalley's the contact if you want to have chicken or beef from Jerry Stroop. But everybody I've worked with as patrolman or even not as a patrolman is more than welcome. So. And
Can you get out of prison to come see it?
some of the people that know me, you mean? Oh, nothing from you, Dwayne?
You know, I was gonna ask Kevin, you were talking about that grant through Matt Arnold. Did you get the email that showed from the forested counties that showed one of the commissioners over east of the mountains there, Cascade, maybe John Prinky?
John Prinky.
Mhm. Yeah. He has applied for a grant also for like 18,000.
18,000.
Almost copied what Matt Arnold does. Truly. And they were wanting, I'll forward it to you when I get home, or Lori can
I
forward it to
can
you.
forward it to you.
They were wanting comment as to what everybody thought about that. To me, we haven't even figured out yet if Matt's effective.
Well, he's far more effective than anything we've got in Montana as a state for
So far,
30 years
but
we've been fighting this.
Do we need another one for the counties? I don't know.
Well, depends, I guess, on what, he's coming at it from the Forest and Focus perspective of the governor's office.
Yeah.
If Montana Forested Counties wants to have their own horsepower and their own coordinator that would bring everything together and utilize all the power of all the counties in
Yeah,
Montana.
they were talking like a forester. you
I
know,
would
what
think
they
that
would-
that entity could work with Matt and thereby double. Is he applying to Matt for this money?
Yeah, yeah,
Ooh,
yeah,
that
the
Yeah,
same.
well, it
well.
says,
The same, yeah.
application that Coalition of Forested Counties would submit for the House Bill 510 funds.
Same, yeah.
Is that the same?
Yeah.
Yeah,
Yeah.
that's an odd place to fund something
That's
like
what
that.
I thought.
Because basically what that's gonna do is fly in the face of what they've tried to create through that 510 fund anyway.
Yeah.
But I can see where some form of that type of representation specific to And if that fits Matt's job description, I gotta think it's not gonna go anywhere, because that's basically what he does already.
Yeah.
So if there's dissatisfaction with what Matt is doing, which I have trouble,
No, I don't think it was
envisioning.
that. I think they were just looking maybe for more horsepower, but I kind of thought it was kind of an odd way to go about it too.
Well,
Nobody had said anything about it, you know, up until they sent this email out and
yeah,
said,
I guess I can see where there would be potential positive from the emphasis of those forested counties speaking to the state, saying, get off your thumbs and do something. Which they've started to sort of do, but they're still not using the horsepower that they have available on behalf of the counties in Montana. And so, to the tune of the whole SRS thing, I don't think the governor's done anything to say we need this money, or
no, I haven't heard.
the Attorney General hasn't gone to them with the lack of PILT payment, or, I mean, to me, the state should be all over that, because that's revenue that's not coming to the state from the federal government that is owed to the state.
I guess if we could get Jim Arnie, get him that position, that would be great.
Yeah, that'd be a fireball
Yeah.
there.
But there isn't any guarantee of that, where all the other forested counties are having to say on it either, you know, I mean.
I gotta think there's a majority, that you might have one or two that's gonna hold out and not want to push like this county does.
Yeah.
But I think the majority are all over any form of change whatsoever.
Oh, yeah, I think
to
so
get
too,
something
but
moving.
it just seemed like an awful odd way to go about it.
Yeah. Well, and it may be too, because I don't know how much Matt would, and that's in Cascade County, you said? Great
No, he's
Falls?
from,
Did it
he's
say
from
where
Red
Brinkley-
Lodge.
is that where he's
Brinkley's
from, Red Lodge?
Carbon County.
Oh, okay. Red Lodge, I can see where they would need that.
So, go ahead, Glenn. I'm just here to get updated from you folks, mainly if there's any new news with Forest Service contracts, or...
Oh, you got the last, no, he wasn't at the coalition.
No, I missed that.
Yeah, so, well, I might be saying it wrong, so. we'll
I
write
talked
it
to
down.
Kevin a little bit about it, but what was your take?
About an EA that was done on the old toboggan one, and so there's some ground up there that now has been identified that has actually some healthy wood on it, that maybe a new EA wouldn't need to be redone, because they're good for.
Yeah, it's already got a NEPA on it.
Maybe
and
just
so,
probably a decision memo. with
yeah,
categorical-
usually that's what Wanda said, a letter to file.
Categorical exclusion.
Yeah, anyway,
Just
they kind of designated an area there that, you know, with the, which one is it, the Good Neighbor or the, yeah, the
Yeah.
Good Neighbor Authority with the state.
Okay,
And so,
good.
And it's somewhere up Rock Creek with some nice standing trees on it, it's not like small diameter stuff.
Rural bed or...
yeah. Anyway, we have a, kind of a subcommittee meeting next Wednesday, I think. Let me look at the calendar really quick. To further identify, you know, what they're gonna do. Yeah, Tuesday, 10 o'clock here, not over at the Forest Service.
Okay. I might be working for the Forest Service. I might hire on to mark trees.
Oh, good.
The express services.
Oh, on the Murphy Creek project?
All right.
Good.
Tuesday when? 10?
Leave me
The
a
10th at
can of paint.
10th at 10 o'clock over at the Forest Service.
Special paint.
Yeah.
Okay. That's mainly what I was just looking for updates on that, and if there's anything new on the state line, boundary straightening.
He was still working on it, he
Still
said it was
working on it,
kind of
yeah.
stalled out again now.
Well,
Probably with the holidays.
and we had an ally in our camp with Zinke, but now Zinke is gonna be possibly moving out of that congressional seat, so. But yeah, Tim thought that with that building and that shed, the new building's about 3,000 square foot, he thought there was potentially $3,000 to $4,000 of tax revenue that we could be getting from that.
Okay, and then on 135 project, that's just
Haven't heard nothing about that.
Yeah, we haven't heard any more on that.
You mean the highway
Yeah.
coming to Regis with the calming effect and the islands and the trees, that one?
Well, mainly just curbs, defined entry points instead of just kind of helter-skelter. And there is some vegetation, some landscaping to collect, that'll collect all the litter that flows around town.
There you go.
And, what else? Well, the paths. Both sides along the fence line will be
Mhm.
paths. That's all about all I had.
Mr. Gleason?
Well, I've got a couple of things I wanted to talk about. The first one, and Lori was involved in the board meeting on the 15th, where we talked about the assisted living facility at the hospital. And it's currently down to 3 individuals in there.
Mhm.
And if we continue to operate it through June 30th, looks like it'd lose about $100,000 in direct costs. And, you know, we need to be really focusing on things that the community really needs. And if it's down to 3 people and one of them's from outside of the county, it's pretty clear that it's not a high need facility.
Mhm.
So the 28th of February will be the last day of operation. We'll send our assisted living license back to the state on the 28th, or March 1st. And then what that will allow us to do is bring that building back into allowable costs for our Medicare cost report. The depreciation expense, the interest we're paying on the loan that we still have against it, all of those kinds of things the power costs can be brought back in if we use it for hospital-related purposes. So we will be moving some hospital-related operations in there. Initially, we'll use it for sleeping quarters for nurses that come into the facility, the travelers, those kinds of things, and get it back into operations. That'll give us another $50,000 to $60,000 a year of Medicare reimbursement that we've been missing out on because of the operation of that facility. The way that the Medicare program works, when you've got non-Medicare operations, they get allocated a bunch of overhead, and when they get allocated overhead, then the hospital doesn't retain that overhead, and then Medicare doesn't pay for it. So that's, I just wanted to come, and I apologize that I didn't get here sooner. I was not expecting it to come out in the newspaper, and somehow the newspaper got wind of it, so I had a little conversation with Kathy, and but I wish we didn't have to do it, but we can't afford to do things that lose us that kind of money. It just doesn't make sense.
I had lunch with Zinke's aide, and prior to that, he'd just come from your guys' facility.
Daines's.
Yeah.
Or Daines's, yeah.
Yeah.
I didn't know if he had any idea. Was he just a good listener, or was there anything throughout that was hopeful for small hospitals in the future?
Well, you know, it's all up in the air right now. Nobody really knows what's going to happen next. I'm going to be meeting tomorrow afternoon with a group of people and Senator Tester to get his take on it. On
Him himself?
Yeah.
All right.
He will be he's meeting with people in Kalispell, Libby, Kalispell, St. Ignatius, and Missoula today and tomorrow. And so I'll be at the Missoula one just
On a Saturday, huh? You're gonna be,
yeah. So
is he meeting with primarily folks in the medical?
Healthcare is what with everything that's going on with the CARE Act and those kinds of things. That's something he really wanted to make a quick tour around the state. You know, he did a rural healthcare meeting in Ennis last spring, and a bunch of us went down and were able to spend some time with him talking about issues back then. So he wanted to do a quick little reprise while he's back in town, there, back in Montana.
Does he sit on any committees in DC that kind of?
He has been on veterans, the Veterans Affairs committees, and so that's a big issue. You know, my perspective on it is, I think we waste an awful lot of overhead dollars. I think that Walter Reed and some of these major medical centers where veterans are coming back from Iraq and Afghanistan and they were injured, those facilities are absolutely critical. But my bigger concern is how much money we're spending on overhead and infrastructure that
At the special branch offices and
all of these kinds of things that veterans could be much better served if they were given some kind of a put them right back into the Medicare system or something, and allow them to use the healthcare system that is actually working, you know, and getting people in. We've had massive problems with the Choices program in lots of communities around Montana. Nobody's still getting paid for services that we're providing, and you know, it has not worked very well, which is not surprising. But I think we could save millions by
then they
getting
wouldn't
rid
have
of
to
some of
travel
the
so far. I know so many
infrastructure
guys that
and
drive to Helena.
Yeah.
You know, and I mean, they have that little office in Missoula, but a lot of times they have to go to Helena for things. And then I hear stories that the doctors, I don't know, speaking out of school here, but they say some of the doctors there aren't good enough to get a job in the real world, so they work there.
Well, and one of the issues is they tend to and have in the state of Montana stolen providers from rural facilities, because when you work in a rural community, you're expected to be on call in these communities and be available to go to the hospital when you're needed. And if they can get an 8 to 5 job at the VA and not have to do those kinds of things, it's much, much simpler for them personally.
Banker's hours.
Yeah. So it does make it difficult for us in the rural communities to recruit physicians as opposed to mid-level providers. So.
Are you a veteran, Glenn?
No, I'm the volunteer driver.
Oh.
And we're still reaching other veterans in the community who hadn't used our service before. We're still trying to get more people to take advantage of our service. But there were times when we've taken somebody all the way to Fort Harrison and all they get is a blood test. You know?
And that kind of stuff just makes me crazy.
Yeah. And why couldn't that just be done anywhere locally?
Yeah.
I mean, that's unusual, but it has happened.
Yeah.
Another time, I think we took somebody all the way over there. I don't know why, I seem to be the driver when these goofy things happen. Take somebody all the way over there, and the doctor or the practitioner wasn't there that day. Could change the schedule or called in sick or whatever.
Yeah.
We're just merely driving government vehicle, government gas,
For
taxpayer gas.
130 miles one way, yeah.
And,
Get over there, nobody's there.
you know, we're all volunteers, but there's the overhead of those fleet vehicles. I mean,
Well, and there's, how much are we spending on the overhead for the VA system? You know, they are supposed to be, you know, medical records and paying bills and doing all of those kinds of things. And if we thought about it and collapsed this into a system that is working to pay bills and track records and do those kinds of things, it just makes sense to me. But there's too many people working in the VA system that it could lose their jobs if we did.
Well, it might help small critical hospitals like Superior and others. Those people who are already got their job and in their spot and with their banker's hours, they don't want to give that up.
Right. Any other questions on what's going on at the hospital? We did put in, we put in a request to the Helmsley Foundation to replace our CT scanner.
Mm-hmm.
I got a call from them yesterday or the day before to gather some more information, and so we are under consideration. It would be nice. That would be we're currently paying $61,000 a year for maintenance on our CT scanner. The new scanner would have 3 years of warranty.
Mm-hmm.
So it'd save us $183,000 over the next 3 years if we didn't have to pay that maintenance contract. So it would be a huge plus for us as the hospital if we could pull this off.
Mm-hmm.
The other thing I wanted to talk about was the Buckle Up Blue for Lauren and the primary seatbelt law. There is a Senate Judiciary Committee meeting next Thursday. Starts at 8 a.m. in Helena to discuss the primary seatbelt law. I will be going over. Taryn Ververis will be going over. His life has been saved twice now with by seatbelts, in rollover accidents. And Pat Goldhahn, Lauren Goldhahn's father, will be testifying that day.
That's January 12th.
January 12th, yes.
And it's a Senate committee.
Yep.
What's the bill number? Do you know the bill's number? I mean, just.
I don't.
Okay, I'll find out.
Yeah. We have. I sent a letter, and I know that some of my staff has sent emails to Jennifer Fielder. She is the vice chair of that committee, to encourage her to support primary seatbelt law. There's going to be lots of people who will be talking about the personal and the emotional and that kind of impact that it has on people when people don't wear their seatbelts. I plan on talking more from the perspective of here's what the financial costs are of people not wearing
I think that's what those Republicans are going to understand better on
yeah.
myself. I mean, there's always, people can always tell a horrible story emotionally of any topic, but what's going to persuade them is
and from a personal perspective, I understand people saying, it's my choice. I'm the only one that's hurting, but that's just not true. You look at Lauren, 15-year-old girl, it didn't just hurt her. The entire state is behind this Buckle Up Blue for Lauren campaign because of the loss of her. So it doesn't just have an impact on that person. A father dies, what does it do to the family? I had my dad's best friend when he was younger, lost his daughter, and that family completely fell apart. The family became alcoholics. Their friends,
which is another problem for the state right there.
Yeah. It has more impact than just on that one person. So if you are interested, I know you said the last time I came and talked to you, if you're interested in going over and talking to them or writing to them as a now I guess former highway patrolman.
That's right. No, I think I'll go over there on maybe Wednesday.
That'd be great.
My sister lives there, so.
Super.
Yeah.
Okay. As soon as I get more information on it, I will get it to you.
Do you want to share texting phone numbers in advance, and then you can.
Sure.
If you're there ahead of me, you can tell me what room it's in or whatever.
Great. My phone number.
Is that your favorite ticket, doing 77 and 55?
Good one, Glenn. That's how we can remember my number now. All right.
No, just a comment on seatbelts. When we did defensive driving training, the Forest Service really harps on safety and
Tim was
periodic defensive driver training.
Thank you.
Everybody had to do it. And people are always overconfident in their driving abilities.
Oh, yeah.
Until you have that close call or wreck, and then you think a little bit more about it.
Well, and I've told this story before. I made a New Year's resolution that I was gonna start wearing my seatbelt. Then that next summer, a drunk driver crossed over the center line and hit me head on.
Yeah.
And had I not been wearing that seatbelt, my son would never have been born, my 2-month-old granddaughter wouldn't be alive. I mean, it's just, you think about those kinds of things.
Yeah,
And
most of us have those stories.
Yeah.
I've survived three wrecks as a passenger because I was wearing a seatbelt and walked away. You know? Just about everybody can, but.
Well, and Scott Waddell,
Yep, yeah.
trooper, he actually was did the investigation on Lauren's accident, and he said that he went to another rollover accident, and there was a blue ribbon tied to the steering wheel of that rollover car, and there's no doubt in his mind that those people were saved by wearing their seatbelts. You know, so. That blue ribbon campaign, you know, it is saving lives already.
Yeah.
Well, yeah, and the other thing is that drivers don't realize how out of control they get when they're not strapped in. You know, if you're losing control of your vehicle, you're flopping around behind the wheel, it makes it even harder to control the vehicle.
Yeah.
And then you have passengers that are flopping around.
Yeah, well, and Lauren died because she was thrown from the vehicle. If she had stayed in the vehicle like the driver did, she would not have died.
All right, I wrote it down on my new calendar.
All right, great.
Just driving around Mineral County, half the people don't wear seatbelts.
No.
Missoula's a little better, but like out here, I'm just driving around in town. I'll put it on when I get on the freeway. Yeah, right.
Yeah.
But there's so many excuses. And
I know.
It only takes a 25, 30 mile an hour wreck to get really busted up.
Yeah, it does.
Especially at the four-way stop, that people get hit all the time.
Yeah.
Well,
yeah, you might only be going 25, but the guy blowing the stop sign's going 60. And then your door opens up and then you fall out on the highway and then you get run over.
Yeah, that was just that one up at Paradise there that the guy got thrown out, ejected, and somebody couldn't stop or tried to swerve to miss the accident and run over the guy.
It will be a challenge to get this through.
Yeah.
You know, what I have heard from the hospital association is that the discussion in the interim committee that was talking about this was that there are people who are afraid of being primaried. From my perspective, if you are afraid of being primaried and it keeps you from doing what's right, I'm sorry, but you've got the wrong job. You know, that doesn't make any sense to me. If that's what your life revolves around, is somebody primarying you, and that's keeping you from doing something that you know is right, I don't get it. I just don't get it.
Well, it'll be a fight with the libertarians and the independent attitudes.
It will.
But nobody's telling me what I gotta do.
Exactly, and that's a Montana trait. It just is. I grew up here too. I know.
Well, the thing is, Glenn, that what I've realized in my job is that, because I started out that same way, I grew up in Montana, but that's their right to not have to wear their belt, but then it's certainly their right and their entitlement to walk right up to the government when their loved one is killed and say, you know, I need the Social Security from my husband being gone, or I need the workman comp claim because he was actually going. We had some loggers that were coming back from work, and that got decided that it was a work-related crash, even though they stopped off at the bar and tipped way too many before they drove home. They were in the process of going to and from their job site. So work comp paid for their family, their kids who were under 18, their Social Security, all that stuff. So when they talk about independence, well, if you then don't, why are we paying so much for when these things happen? It's not just the cost of the family.
That's exactly right.
It's the cost of running the entire government.
And how much is my insurance going to go up because of the $100,000 worth of helicopter and plane rides related to one accident?
Right.
You know, we worry about There was an interim committee that talked about the cost of helicopters and you know, the cost of flights and insurance not covering those things, and numbers of those that had to happen would go down if people were wearing their seatbelt.
Yeah.
So, you know, let's talk about that for a change. Anyway. Well, I
Very good.
appreciate you being willing to go to that.
Yeah.
That's wonderful. I will let the Hospital Association people know that you're going to be there.
Okay.
I think Taryn and I are going to leave early on
Yeah.
Thursday morning.
I think I'll go over the night before and see my sister. And my son Kenley just got out of the Coast Guard, and they hired him over the phone. He's a sergeant at arms over there. So
Wow.
Cool.
In the Capitol?
Yeah, he picked the House side, not the Senate. They're too stuffy in the Senate. He likes the history of the columns and the big Charlie Russell and
Very cool.
yeah, he's kind of a glorified security guard, but he's over there.
Yeah. Sounds great.
Cool.
Yeah.
Okay, well, that's all I had.
All right. Well,
Any
thanks for
other
taking
thing?
the time to come down and
Yes.
No problem.
update us. I
Yeah.
mean,
Yep.
Yeah.
we do get a little bit from Lori, but it's always
Yes.
nice to see
I
you too.
tried
Yep.
to report back after the hospital board meeting as to
Yes.
what's going on, so.
Well,
Yeah, I really wish you success, Ron, in keeping
Yes.
this hospital.
well,
Yeah, so I
you know,
mean-
this will be a big help if we close this, and it'll make more than $100,000 a year worth of difference. And it's good to have Jeff Chelmo coming down to cover emergency room. If you need ER, he's great. So he will be great in our ER.
We just need our specialty services back, our scopes and.
Yes. As a matter of fact,
Not like having to go to planes.
I just got a call from Dr. Tata, who is going to be on the board in January, and there is a Dr. Z, Zenon Feng, Z-E-H,
Is he Asian?
and P-F-E-N-N-I-G.
Wow.
That's how you spell his name. But he is a surgeon, and he is interested in coming here to do scopes.
That would be
Is he
great.
Asian or Korean or?
You know, I was thinking more like
How do you spell that again?
Z-E-H-N P-F-E-N-N-I-G.
Pfennig, 10 pennies.
And Fennig.
10.
What nationality is that then?
German.
It is?
Yeah,
That's
Zane is 10, Pfennig is pennies. So
Oh, wow.
10 pennies.
Really?
Dr. 10 pennies.
Dr. Tim?
There
So
you
he-
go.
Oh, it sounds like he's cheap. I can afford him then.
Yeah.
Everybody, it's my understanding everybody calls him Dr. Z.
Yeah.
Sure.
So, but,
Yeah.
Oh, that'd
Oh,
be
good.
great.
yeah.
Dr. Tim.
So we're gonna talk about it. It's, you know, there are some other issues that need to be worked out, whether he does conscious sedation as opposed to
Oh.
having to have a CRNA and some of those kinds of things we'll need to figure out. But anyway, it's a possibility of getting that back.
Good, good, good.
Okay.
All
Thanks,
right, well,
everybody.
thanks,
Take
Ron,
care.
and appreciate everything you've done.
Oh,
Stay warm.
glad I'm here, yes.
Those mills have been allotted to the different departments. In regular collections, the mills get plunked in, dropped into our budgets. The ones that are now collected and able for the county to use, do they get?
They get allocated based on however the mills were allocated in that year. So if they collect taxes from 5 years ago, it will be allocated based on how the mills were that year. That's how that works.
So we should see those
You
come into
should.
our budget then.
You should, correct. Yep.
Well, get out there on that tax collection thing.
Good.
Get Polly going.
Good.
Roman's retired, he might have some time to go.
Yeah. Go be tax collector?
Put the sticker on it. If we have stickers.
Yeah.
So, we got a 2 o'clock with Jim Morton and HR. We just thought we'd have a powwow and see if there's any projects on the horizon or anything like that, because we haven't talked to you for a while.
We do have one project here in Superior. We got funded for housing. That's going to be a 3-unit project at 3rd and Maple. And those will be for senior citizens. And they will be 2-bedroom, bath and a half. And they'll be fully universal design, which means the doors are 3/6. And there's turnaround in the bathrooms and that kind of thing. So 1 unit will be completed, well not completed, will be built by the Missoula College Carpentry Program. And then 2 will be built on site. They will truck the one built by the carpentry class out, and then it'll be finished on site. So that's something we haven't done. And
So that's like a VOTEC class?
Now you're showing your age, because I used to call it the VOTEC because I remember it was the VOTEC and I get corrected.
Oh.
College technology now.
No, it's Missoula College.
Oh, it's Missoula.
You're as old as we are.
Damn.
Dwayne's probably older than all of us.
Yeah.
Yeah, some of us remember was the
I might look
VOTEC
like I'm older
part of
though.
Missoula County High School.
Still young.
In the old days, out there on south. But
Not
anyway,
Sentinel, but Helge.
no. So anyway, they're doing that. We will bid then, because it's funded by HUD through the Department of Commerce. So we'll bid that out for the 2 units, and then the on-site finishing. The architectural stuff's all been done. We are, the town of Superior sponsored that grant. So they will, they have the contract, they subcontracted with us, that's all been done. And then we use their procurement, so we procured an engineer to review the stuff that the college is doing.
Ah, so the town of Superior kind of spurned that by sponsoring it. And then
Yeah, we've been wanting to do something, and so the Department of Commerce now was moving toward having jurisdictions apply instead of nonprofits for some of these funds. So they changed their mind 3 times. So I think the town council in Superior thought I was kind of making stuff up, because I was like, we need a letter of support. Okay. Then I came back and said, no, I think you need to sponsor it. Oh, so what's that entail? Okay. Then I came back and went, now they changed their mind. They want us to do it. Then they changed. That's 4 times they changed their mind. So anyway, we got it done. It's all awarded, and the contracts have been signed with the town and with us. So we will now go out to bid sometime this month for the 2 units to be built on site, and for the 3rd unit to be finished on site. The only other housing project we have this coming up is in St. Regis. And I like what Jessica did, so I'm going to copy her, and we're just going to build all kinds of rentals out there, because hers looks so nice.
Don't copy.
So that project was up on Mill, and it was owned by Scott Cooney. It was somehow involved in a lot of stuff with a bankruptcy. There are 14 lots in the subdivision, and we purchased the entire subdivision. It has electric and sewer hookup to each lot, and then the road kind of goes through the middle. There's about 11 acres, and I really don't want to do rental, but I'd rather do home ownership. So that's what we have planned there. We're not sure exactly how to do that because the market is what it is. We're kind of waiting to see what happens there. Interest rates have jumped up from about 4% to 4.5%. And for some folks, that that's not a big deal, but for folks with a little bit lower income, that is a big deal. It makes a difference in the payment.
What kind of square footage are you thinking of the home?
Well, we're really thinking, well, there's a couple ways that it could be done. We could do smaller units, couple of bedroom, 2 bath, garage, carport, and develop it ourselves, targeting seniors as an example. And
1,400, 1,500 square foot.
yeah. And that configuration would have to come back in to planning and talk to the guy over here who does that stuff. So that one thought I had about that subdivision is that it was just, in my opinion, developed oddly. They had those riverfront lots. There's like 7 of them, and they started out at 85, and then they had the remainder in the back, and not much access to the river. Well, who's going to go to St. Regis, no offense here, and buy a 14,000 square foot lot for $65,000 when there are other lots larger, and maybe have a better view? So I think it was just odd. So then they never sold one of them. So my thought is one idea would be to do home ownership, but leave some of those lots on the river open for common area. So that's an attraction for folks who want to do something, walk down to the river or whatever. But the way that was developed, I just thought it was an odd. And if they'd have thought about it, I would have probably developed it into 1.5 to 2 acre lots, put them on the market that way in the beginning, because they would have had the sewer and they would have had electric, so then you're just doing individual wells. So that's one thought. The other thought, then in that approach, we would probably try to build those units and sell them as we build them.
So the private ownership one,
Yes.
those wouldn't be tax exempt like your house?
No, those would be for sale. And then
They pay taxes
Yep.
on it.
So then the other way to,
If you want my opinion real quick, I gotta go here at 2:30, Jim, but if you want my opinion on that, I would like to see it go that way.
yeah, I'm not, I'm, as I mentioned to our board and the local advisory council, I don't want to do any more rentals, because with the 3 we have coming on sometime this year, we'll own 67 rental units in the county. To give you an example, so we have about 4,100 folks in Monroe County. Ravala County has 41,000 people. We have 98 units there.
Wow.
So we don't have that many there. We have Monroe County is really a high concentration for us. Missoula County population is about 114,000. We only own 36 units there.
Really?
Yeah.
So we have a lot of units.
So you're thinking you're,
So I don't want to do any more rental units.
other than your 3 that you're already doing here?
not because I
guess
don't understand the rental market here, because I do know that the rentals are needed, but I think it's too much for us. I think, the other people should be developing. So that 11 acres in St. Regis, I really want to be home ownership. I'm not interested in.
The reason I said that is the veterans built that little building there at the end of Mill Creek Road. That's their that's their
yes,
meeting place
yes.
now. They're getting a tax bill for that little piece of property that was nothing but a mud puddle. Had John not donated that to him, it'd still be a mud puddle. $1,000.
It will
a
be
year.
waived.
Huh?
They will waive that.
Bob Carroll was in last week and said that they told him no.
After, because I did all of the legwork for them,
Huh?
filling out everything, and they had told me that
That they, yeah.
that they would, but it would be next year, which would have been this year. He shouldn't have gotten a tax bill.
Huh? No, he would.
And I did all of the work
'cause
for
he was
him
in here
to
with
help
us.
them.
Isn't that a large piece of ground, though? I mean, the little building is small, but
It
No, it's
isn't it
like-
3 acres or more?
Oh, no. Well,
maybe.
maybe.
If you count the bank,
If
maybe.
you counted the bank down to the river, maybe.
maybe.
Yeah, and that's what he
But-
said
but-
was,
Oh,
that's
just all
why
down
they-
like that, so if
Yeah.
you look at a
Maybe
map,
that's, so maybe they came up with that after the fact.
Well, it was riverfront is what they told me.
We've
That
got a
was-
meeting with them here in a
Yeah.
couple weeks with,
Bobby Carroll?
yeah. And so
That's
maybe
right,
if
'cause
you could
I
come
really
in.
thought
But
I
if
had
that
it all
little
taken
piece-
care of for
I
them.
mean, if that little piece there is $1,000 a month, or a year.
With the
you know,
building on it,
for-
but yeah.
Yeah, I mean. you know,
When we
I'm
bought
old.
that property, we
That's,
cleared up all the back taxes, and Lori told me I'd get a percentage of that.
yeah.
How'd that work?
I didn't work well at all. So we are paying taxes on that, and the sewer hookups, because in St. Regis, you don't pay your sewer hookup fee. They're
They get
they're
nasty,
tough.
don't they? Yeah. They even do that when you don't pay your bill.
Oh,
I don't know how I know that.
But you've heard it
Yeah,
in
I've
the
heard
community,
it.
yeah, you heard that. So
Kind of a talking bird.
Yeah.
that project is the only one we have probably in the housing after these 3 units. Then the other units we have are usually within the expected vacancy, 5 to 10%. Two Rivers it has more vacancies than we projected.
Is that the one in St. Regis?
Uh-huh.
And that's just because the income, I mean, unfortunately,
Yes,
with the money
it's
that.
restricted.
The money that, or the grant you use to do
Yes.
it, it's so restricted. It is
Mhm.
horrible.
Yep. And
So it's, the income, it has to be,
50% or 55% of their area median income, and we don't have any authority to, that project,
So that
8
seems-
units there and the 24 units here at Superior Commons they're both under the housing tax credit, and that's an internal revenue service program. And that's all private sector investment. So we just don't have any latitude.
after so many years, can it change?
45 years is the deed
Oh, so
restriction.
we'll be stuck there forever. With, how many people are even renting that?
We only have a couple of vacancies now.
And
It
it's 8
varies,
units.
yeah.
Okay.
There's quite a turnover. I mean, it sure seems like.
There is. Mhm.
Yeah.
But we've lowered the rents.
Oh, really?
Mhm.
You did.
We can lower the rents, we can't raise them over above what the.
Oh, so you can lower them.
We can't raise them, it's a formula that's prescribed by IRS.
I see.
And in
Because
that,
the problem with that, I think, from what I remember, is, say like a teacher, they're
that's
just a
exactly
little
right.
bit over, aren't they?
Yes, exactly,
Yeah.
exactly.
It's just so, and talking just a little bit.
Right.
Yeah.
And we have no
Yeah.
flexibility at all.
That's-
And in that program, you have to form a limited liability, limited partnership.
Mhm.
And the tax credit investors own 99.99%. Because they get all the tax benefits. And that's where the equity is from. So we sell them the tax credits. So we got about a $1.3 million worth of tax credits. We sold it to an investor group. They gave us about $1.15 million for those 1.3. So we manage within those guidelines, and we're responsible. And then we have to guarantee the operations. So if it runs out of money, which it did, we have to continue to operate them with whatever money is available to us outside that partnership. So that's the challenge. Now, Superior Commons is operating the 24 units there. It operates within the expected vacancy, which is again 5 to 10%. It's completely different.
Well, with your strict income rules, what do you have to review? What if somebody got in the apartment and then later they got a good job? Do you have to review them every 2 years or something?
With the tax credit project, once you're in, you're in. You can win the $100 million lottery. You're still eligible because once you're in, the idea there was that they didn't want to disincentivize people from earning more money.
Mm-hmm.
Now, in some of our other projects, if you make more money, then you would no longer be eligible.
I see.
And we do those annually.
Uh-huh.
You have to come in and recertify annually.
Because I had a few younger highway patrolmen looking for housing, and
Mhm.
they couldn't get into yours because they made just a little
Yes,
too
just
much
a little
money.
too much money.
And then, but then they know people that are living there that are making as much or more as they are, so they, well, what happened? So I didn't know if they had to be reviewed or not.
We review them annually, and
At the Superior Commons?
Yes,
Oh.
yep. We can't do anything if their
Oh.
income increases, but we report it.
I see.
So it's more of a data gathering kind of thing. We
Mhm.
report.
So they
the
need to
over-
work part-time or
Mhm.
3/4 time, then they can get in, and then they can
Yeah.
go full-time.
Once
What about
they're in
those-
there.
And
Well,
then it would be
What if they're
okay.
a pig? What if they're only one person and they have a 3-bedroom and you have a real need with a family of 5?
We try to not rent the 3 bedrooms,
To a single.
right? But you get into fair housing
Mhm.
stuff. So, but usually we're trying to persuade people out of that just for that very reason.
Mhm.
Now, one of the things we did when Tricon, I think last year, year before, when they went to their RIF, we did send out and they worked with us, send out to folks who were being laid off, because you project the income. So when they're laid off, they could qualify, and once they're in,
Then they're in.
then they're in and they can make more money. So we have done some of that. I think there weren't very many folks who needed a rental. Some of them were driving already. Some of them already had housings. But we thought there might be some group of them that, because we had interest from a number of them, but they're over income.
Right.
But when they were laid off, but by that, a lot of that changes, and it's always the wrong time. So when we're full, that's when we get the inquiries. So it's tough trying to time it.
On the housing in St. Regis, have you guys decided for sure that you're going to be marketing it to, like, is it going to be a 55 and up?
We haven't decided that as much. I don't see, we have a first-time homebuyer loan program, and that program will loan up to $35,000, 0% interest, and it's non-amortizing, which means there's no payment on the debt until the property is sold. And it's simple interest. I love compound interest, but I couldn't get the board to go for good compound, because that's pretty sweet stuff, because then you're charging them interest on interest, right? So, but we don't do that, just for the record. So we don't have a lot of those loans in Monroe County. Number one, the housing is just not as available as one would think. We can't go over a certain amount. I think it's around 210 or something like that, and there's not a lot on the market. But that has been over the years we've been doing it. So I don't know that there's much demand other than for seniors, because there are a lot of seniors, and what we're trying to do there is get the price down by keeping the square footage down. And it's rural development does have a 1% loan program, and they could also, if they're income qualified, get our $35,000. So when you add that all together, it makes the payment pretty reasonable.
But anybody could qualify for that.
Mm-hmm. But
A family of
yes, anybody.
4.
But we haven't seen that many people buying homes using that program in Monroe County. In Ravalli County, Missoula, just the opposite.
We have quite a few.
Yeah.
Every month we
Yes.
have 2 or 3 in Missoula.
I wonder if people just don't know about it, possibly.
Could
I wonder
be.
if, I know Judy knows about the program, and I've heard her mention it to a couple people, but maybe other real estate agents don't know.
We go to the banks.
You would think,
We
right?
go to the lenders.
Yeah, you would think they
our
would know.
loan officer goes to the local lenders.
So you're not sure, so you could market it just to
We could to anybody, but I don't know that there's a market for families, because then you're not building a 2-bedroom bath and half or 2-bath. You're going to build a 3-bedroom, because most families don't want anything less than 3-bedroom,
So right now,
and that escalates the cost. and then we build them and they don't sell, then we're kind
Mhm.
of sitting. I just don't see the people with the ability to buy.
Mhm.
You know, number one, there's only
I
4,100
can think
people
of
here.
3 families right now in St. Regis that would probably buy one of those, and their families.
Mhm.
A 3-bedroom?
Mm-hmm.
But it depends on the price point.
Yep, our principal.
Mm-hmm.
But he wouldn't
and 2 other
qualify,
parents.
yeah. See, there's sort of
Well, couldn't,
the rub, because
But your residential.
if the private sector, if somebody wants a home and they can afford to borrow up over what our limit would be, then that's a private sector negotiated home. And we wouldn't want to be part of that because we try to fill a niche for those who wouldn't be able to buy the home. But if you talk about some folks in the county, they have enough income that they wouldn't need our assistance, and or they're over the income limit anyway.
I guess I don't understand. So if I'm gonna buy one of your 2-bedroom houses that you're gonna build,
We're targeting,
what can I make?
let's see.
Yeah, when you're talking about those for sale lots, I didn't know there would be, I thought you were just.
Well, no, that's right. There's 2 different options here. One, we'd just sell the lots. The other one would be we build the houses.
Oh, so if you sold them the lot only,
Then it's
wouldn't-
their business.
It's their business, doesn't
Mhm.
matter what they make.
Right.
But if you have the house already on it, they have to do the
But
requirements.
you said that decision hasn't been made, and
Right.
you can't make that decision.
Well, we're waiting. I'm just waiting, kind of see where the market's going. You know, a few years ago, Mineral County's on front page of certain magazines because it's hot. You know, things are selling, and now,
Now we're on the back page.
yeah. So,
It's pretty hot. There's no houses right now for sale. There's,
Oh, really? We're
in the
still hot?
entire county, we were just looking at it, there's 43 houses that are on MLS in the entire county. In St. Regis, there's only 3 houses below 100,000 right now, and only a couple below 2. There's no houses for sale right now.
Hmm.
They have all sold. Is the conversation that Judy and I just had a couple hours ago. And she's, I mean, there's nothing to sell.
Wow.
Mhm.
And it sucks that we have only 9% private land here to expand on.
And that's the thing, right? I mean, we really don't have.
We need the Forest Service to give us a couple of half sections here and there along the river.
Along the river.
Along the river,
Mineral
that's
County.
what they
That's
want.
right,
That's
houses
what
and
they
selling
want.
them.
Right.
A family of 4 could make around 48,000 annually.
Mhm.
So it's high.
So that's,
Comparative.
that's normal. I mean, for me, I mean, most people in St. Regis make 48,000. Those are the people that can go out and get a normal loan
Yes,
too.
yes, that's the point.
So you, I think, in essence, you are kind of competing against, like, say if Joe and I were to go out and build a 1,300 square foot house on a lot, you and I would be competing on who could. They could buy my house or they could buy your house, correct?
Yeah, that could happen. Again, we're talking about a system where they have to borrow as much as they can, so they go to a local lender with that kind of income. They look at their debt, their credit history. Then they're told by that lender how much they can borrow.
Correct. They get pre-approved,
Yep.
right?
So then they can come to us, but we don't. They don't get automatically 35,000. We only loan the minimum necessary for a modest home.
So really, they
So-
would end up going with you, I would think, over me, because if they go with you,
Well,
they
two
can get a
different
down
programs,
payment
right.
and not pay it back
Yeah,
until they
the
sell
first
the house.
the first time home buyer program is open to anybody. So yeah, they could choose if we built something and you built something. In that program, they could buy from either one of us if they qualified income-wise. The other idea that I've had again is if we are trying to get a smaller home, so it's not going to cost as much because it's going to be a 2-bedroom smaller home, not a 3-bedroom, and we're targeting 10 to 14, or as many as we can sneak in there. Let's say 20. Tim wouldn't know. So whatever we can get on there.
Unit of, okay.
On that property, because that's the part we're talking about. Then we sell them pretty much for the same amount of money because they're going to be the same because we're targeting folks who want a smaller home. So that by definition is going to move out of some of the folks that you're referencing because some of them may not want a smaller 2-bedroom home. They may want something that's more 3-bedroom.
Yeah. Yeah.
And then the key there is that if they go for the 1% RD money, they also have to be income qualified.
Which doesn't sound like it's significant, though.
Well,
I mean, it's not.
It's a little bit less than the area median income. So in that program, then they could still get our other money, our home buyer money. So the idea is to at least look at the income in Monroe County, which is low, and try to fit in a product that is meeting the need for lower income folks. And some of it's because the rental market is what it is. A lot of folks who I've talked to are concerned about the current rental market not being accessible to seniors because you cannot age in place. So the product I'm thinking about in St. Regis, because we have the property, would be that aging in place idea. So they'd be universal design, wider hallways, turn around in the kitchen, turn around in the bathroom, no steps.
And I think,
and then you're targeting
I think all of that
certain income seniors because I keep hearing that there is a need for that kind of rental, but rental's a little bit scary because
we already have so many of
yes.
them, and they're not working that great.
Right. So
St. Regis, at least the ones you have.
Right. So that's why we sell them.
So this is the.
And then it's like any other
I know
sale.
when
They pay taxes, and then we're out of it. We don't.
Right.
We don't babysit. We don't do maintenance.
Everybody that I've talked to in St. Regis, and I know that the majority of my people that I've talked to, we've all filled out your survey forms, and none of them are in favor of what you're doing in St. Regis. So it's interesting to me because what St. Regis needs is we need housing for families, because right now we have people that work at Tricon, we have teachers that have kids and they don't have a place to live. That's the need.
Are you interested in buying a subdivision?
The spec house market, there is a big need for spec houses below 200,000. That's where we
but
think
did
the
you
market
know
is.
good luck in building one
Below 2.
Yeah.
Yeah, it's really, really tight. You have to find some really inexpensive property. So, I don't know. I just feel that it just seems to me like you're competing possibly with what I do. And that just kind of rubs me a little bit the wrong way. And then it would be different if you were doing something
in terms of the spec housing.
Yeah. And then I think the other thing is it would be different if you were going to be doing something that the people of St. Regis wanted. But because we're not, the people of St. Regis aren't saying, oh yes, bring in more seniors, right? That's not really what the need is, even though I think that is the population growth. But what we want, we lose kids all the time. We lose families. They'll come in. We don't have anything to rent them in St. Regis. That's where they want to go. And instead they move to Superior because there's more housing down here. And that's where the
or
people...
Or worse, to Plains, out of the county altogether.
Out of the county altogether.
And they still can work at Tricon.
Well, that's the other thing.
But I'm just saying that, and if you were to look at your surveys that everybody did, that's what everybody was saying.
That's why we haven't rushed into anything.
Yeah.
Because on the other hand, I keep hearing the need throughout the county for seniors and accessible housing in terms of how it's built, because we don't have it, and we have a lot of aging in place folks that are having a difficult time.
We're a very old county.
So you might have the reverse. Somebody from Superior is moving to St. Regis because that housing is attractive for them, and we get the price point low enough, they can afford a mortgage. But on the other hand, we want to move these because, as you know, one of the reasons that property came up is that subdivision went nowhere. And
right, they were asking so much.
Yeah.
It was...
But they even discounted the lots toward the end there, and nobody was buying.
But it
So
didn't go anywhere because of the foreclosure bank loan.
Right, it was never even
I don't think
advertised,
I don't
was it?
think they ever got the opportunity to even put a lot
I
on the
don't
market.
think there was ever.
No, that it was not. It was part of the Cooney foreclosure, but that land was excluded from the final process. Those lots were on the market.
For
Jesse.
3 years, you had to pay $1 million off up front to even take possession of that property.
Well, that's what the liens were, but
So you couldn't. I couldn't go and I couldn't have bought a lot.
no, you could have.
No.
Jesse Egan in Missoula. If you looked on the MLS,
They had them.
they had them.
They were
By
really high
lot,
though.
yes.
85,000 for a little.
No, they
tiny-
marked them down.
What were they down to?
I think at one point they were looking around 45 to 55 for the lots on the river.
Hmm.
So you see,
Yeah, I didn't.
when
we never knew that, but
yeah, when we purchased them, that property had been excluded from the bankruptcy. But as Tim mentioned, what the lien holders did was they put liens on every excluded piece of property owned by Scott Cooney, and they had $1 million on that project, and they had $1 million on the 170 acres in St. Regis that he owned, and they had the same stuff on the property that he owned in Missoula. So when we negotiated that, they reduced all of that, took our offer, and removed the liens.
I hate to leave this conversation, but I got a dentist appointment.
Well, lucky you.
Yeah.
I hope it's not as painful
No.
as this conversation.
Thank you.
Bye.
So anyway, we could. It just didn't go anywhere, and that's of note because if you invest money and you want it returned, you have to be careful what you put on the market. So we could and have talked about going back through planning and creating 10 1-acre lots and just putting them on the market and see where they go. But when I talked to Judy as a realtor and others, everybody wants 2 acres because they don't want their neighbor peeking in at them. I don't know what the hell they're doing that they're afraid that somebody's going to see, but okay, that's beside the point. So would 1 acre sell? And what's on the market on the river, that's 1 acre. So I thought about that. But the way that subdivision is, there's a road that cuts through it, through the middle of it. Well, what do? Do we tear up the road and then go back through planning and boom, 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 boom? And we have 14 sewer hookups we're paying for. Mm-hmm. And we might want to reduce them to 10. We could do 5 2-acre lots and see if those would sell. So there are a lot of, again, going back through planning and trying to design something. But then the way that was designed, that road cuts through there, and you have those lots in the back on the county road there. I don't think anybody will buy them. Nobody bought them. Nobody bought them on the river, even when they discounted them.
How big are they? They're really small, aren't they?
They're about 13,000 square feet, somewhere in there. But remember,
So not even a half an acre.
but
They're
remember,
smaller than
part of that's
golf.
on the bank.
Yeah, they're really small. I know they tried to.
The building size is small because there's a setback from the river, and then
Sure.
you're owning that property that goes down so
Yeah.
far to the bank.
Yeah, so you can get. Yeah, that's small. So like the golf course has half-acre lots, and
But the way that thing goes,
yeah. So-
we couldn't do half-acre lots and probably get as, because they'd be long and narrow, or you'd have space that's not used. I mean, that's part of it. From my perspective is I don't want to have a bunch of property that I own after selling those lots. I could put it in common for the owners and do a bunch of half-acre, and that might work. But there again, what's the market call for half-acre lots on the river? I mean, I don't know. I think it's not as much. People seem to want some acreage.
I don't know. I mean, you'd have
But
to
my
talk
question
real
back
estate
to the
agents.
folks in St. Regis is, there are lots on the market now. Why aren't people building on those? I mean, if there's a pent-up demand for families and they have the ability to borrow.
Because really the market
Why aren't they buying the lots on the market now?
We need what we need. For example, like I live in a house right now that's in downtown St. Regis, and it's 1,200 square feet.
Now, wait a minute, St. Regis has a downtown? I said that for Dwayne's benefit, he's not here.
Does. Roman thinks it's really
keep it up, Jim, that's funny.
Yeah, Roman thinks it's really funny. But it's a 1,200 square foot, 3-bedroom, 2-bath. It's right in downtown St. Regis. And I think that, you know, and you could sell that house for $145,000. And you could, I mean, if you were to build those and like the smaller 1,200 square foot, it's a 3-bedroom, 2-bath.
Mm-hmm.
Judy wants me to build this house 2 times for people.
Yeah.
They like it. The retirees, 1,200 square feet. So it could be a 3-bedroom, 2-bath. It could be for a retiree or for a family.
Right.
You know, people don't need as much square footage anymore.
Right.
The bigger houses are kind of not in as demand anymore. And
At least not in this area. They are coming back, though. By the way.
maybe some of this, yeah, but people here, they're, I don't know, the bigger houses aren't as in demand. They're not.
Yeah, in this area, yeah.
They're, yeah.
But back to my question, if that demand is there and there is land available and there are
But
contractors.
there's hardly any land available, really. I mean, you have like a lot on the golf course. It's too expensive. It would take you over. I mean, that market price of $200,000 and under, that's where we need to try to be. That's where the market is for all of these families that are moving in. I mean, I could buy a lot on the golf course and build a house, but I can't get it under $200,000.
Right.
I can. The only place I can.
What's
do
a
that,
lot selling for there?
55.
Yeah. Okay.
Yeah.
Yeah.
The only place that I can do that and actually make a house that I think would benefit St. Regis is to buy some of these lots downtown. You know, like there's some vacant lots.
The old platted lots from this
Yeah.
old town site. Yeah.
Yeah. But to get it under that price. I mean, other than that, I think it just doesn't really meet the need of these families that need to buy a house.
Well, you made a joke, Jim, about, hey, there's a subdivision for sale. Are you able to sell some of the lots, or do you have to sell that? If you were to sell that subdivision you just acquired, would it have to be the whole thing, or can you?
You could sell it by the lots right
You
now.
could sell
couldn't
it by
you?
the lots right now, but I don't think they'd sell. The back part of that property, I just don't see selling. And that, once I sell one of them, right now, we're in control of the entire subdivision. And the
If you could
covenants,
build,
we
like,
can
townhouses
go
on
back to
that
planning
back.
and ask for changes in covenants and
Because they're
plan.
single-family residents.
Covenants are really tight on
Yeah,
Yeah.
so we'd have to go back, go through the process, and then change that, which I think we'd probably have to do anyway. But the question is, to what do we change that will sell? Do we do one of the options would be, we build something, ask for planning to maybe allow us to situate houses on the back part of that and keep riverfront open, and that might be an amenity that people might want. That's an option. The option also, we go back to planning and say we want to develop 1-acre lots. Go back to planning and say we'd like to develop 2-acre lots, what will sell. But if I sell one lot,
Sure.
I think I'm done
You're headed
because I
down the
don't
road,
own,
yeah.
and my ability to go back to planning unless I get the one lot owner. The bank actually offered us a deal to take a bunch of the lots, and they would reserve the lots for sale, and I rejected that because then I'm stuck with lots and I have no authority,
You don't
no
have the
ability
control over all of them to
go
change
back
it.
to planning and at
Yeah.
least try to get it changed.
So can I ask you another? So this
Sure.
is another rumor I heard, and I don't know if it's true or not. Well, I don't think it was a rumor. I guess Judy even said that it had come up in your meetings, but that you were considering building storage units. And then I heard that you were somebody who was selling you guys a lot, and you were going to put storage units on it or something. No.
We weren't going to.
Did you guys used to have a storage unit?
And you had
No.
Oh.
Oh, because Judy even said at the meeting it came up. No?
I don't, it might have been one of that I was not there.
And then I had this,
We've talked about
then I had one
storage,
individual, oh, you have?
but that's just in general, not for us to develop.
Oh, what does that mean?
Well, storage units are, in the right environment, are great cash cows. So they pop up everywhere. So I think we might have got into a discussion about storage units in terms of the rentals that we have, do we build storage units as part of our rental projects? Would that be something that would be attractive? But it wouldn't be to the general public. I mean,
It would be storage units for
the tenants.
Tenants.
We have some storage in some of our properties that are already built into the project. The only storage that we really have that we allow access to the public is in Hamilton, and that's storage units behind one of our multifamily projects. So other than that, the storage we have is already built into the project, and it's for tenants only.
It's for tenants only, okay.
Mhm.
So, well, it really was just a rumor. It must have been.
But we do
But I
talk
don't
about
think it-
storage, because one of the things when you move into multifamily, where does that household store their kayak, their boat, all
At
of
John
their
Kelly's
stuff?
storage unit.
Okay, but if it's not available, where do they do it? So that comes up when you plan multifamily, because anymore you have to have some part of the project with storage. So in Two Rivers, we have garages for everybody.
Which is just part of their rent.
Right.
And that's fair enough, and that's different.
Yes. So that's probably the conversation that we had, is that when we develop multifamily, we're concerned about storage, because we don't want them, in like Two Rivers' case, using garages for storage. We want them to park their cars there because we have so many parking spots, and we assume they will be using their garages for parking. But what we find is that they might use them for storage, this exacerbates the parking problem. So most developers now are looking at providing more storage in multifamily. So if you look at Commons over here, there's a small storage in the back of each apartment, but that really isn't enough. So if we were to do that again, we probably would try to provide more storage on site for tenants only. But we do have that conversation about.
And
the
do
need
they
for
pay
storage.
additional money then for their storage?
Not right now, no, because the storage is kind of a large closet.
But when you build these storage units, do they pay additional money? So you're like, okay, you rent for me, but so now you can rent this for $30 a month?
It depends on the funding source. Most of the funders will not let you do that. It has to be included in
So
the
it's
rent.
part of the rent?
Yes.
Okay. Thank you.
Has she been nice today?
I guess. She's always nice. Just always nice.
Yeah, okay. So, because I heard there was a piece of property that was somewhat adjacent to the commons that they were selling you.
Well, that's a conversation about Two Rivers.
This was down here in Superior.
Thank you.
In their rent.
We
But why would you do that? Like, why, like, so I own storage units so now, I was thinking the whole problem was in Superior, but now it's actually even in St. Regis.
Mhm.
So you're thinking of building storage units in St. Regis
for tenants.
that your tenants could use?
Mhm. Small.
Why would you do that? Why? I have a storage unit right down the road.
Marketing, just like any other developer.
But you can't rent them now. I mean, it has nothing to do with storage.
I don't know that.
It has to do with their income because the
It could, but also could do with storage. I mean, that's part of any development, is trying to understand your market. What amenities will people enjoy? That's sort of like laundry. There was a time when we couldn't do in-suite laundry. You had to go to the laundromat. Well, the people that owned the laundromats didn't want us to build units where there's a laundry in every unit, because they had a business as a laundry. But for marketing purposes, it's a no-brainer anymore. To rent a unit without laundry is kind of tough, because it's the expectation.
So you're saying the expectation now is also to
Have
have
some
storage
storage.
unit, and then they can pay additional money
Mhm.
or whatever for it.
Mhm.
But if they're gonna pay additional money for it, then don't you think it would be fair enough for them to pay additional money to go rent John Kelly's storage unit?
Well, from a business point of view, no. Because I need to figure out how to market those units and what amenities that I need to put in there I have to do from a business point of view, as any business person would do. And if it's free cable, it's free cable. If it's whatever it is that I think the market is expecting, I have to move toward that, and that's an ongoing discussion. So, for instance, we have units built in the 70s, and the Bitterroot, you kind of go down a long hallway, and there's no outside access. And that's more of a barracks type environment. People don't want to live in that. So we went in, remodeled that, and we put balconies, put outside doors, French doors, onto a balcony in each one of those units. Some of the tenants didn't like it, complained. And my point back to them is this: I have an obligation for the next 30 years to the investors to keep those marketed and to keep them full. And if the expectations change, because somebody who turns 65 today is not somebody who turned 65 in 1995. They're internet savvy, they travel, they're in relatively good health. So as an owner, I have an obligation to investors to keep those things marketed, and that thing then goes with me every year in terms of what's the expectation. We just put $1 million in a project in Hamilton, and every one of those apartments now has laundry facilities. Because why? That's the expectation. It's a senior project. Seniors are not interested in this kind of weather, schlepping their laundry down.
Right.
I don't care who owns it. They're not interested in doing it.
Yeah, we don't even have a laundromat here anymore, do we?
Yeah.
Oh, do we?
Well, I think we still have the Hilltop.
I think we
Oh.
have one in St. Regis too,
Oh.
but nobody, very few people use it.
So, I mean, the point is that no matter what
Yeah.
the issue is, whether it's storage, laundry, cable, if you have that kind of embedded investment, you want it producing for you, and you don't want vacancies. And so that's constantly searching the market for whatever the market is at the moment. And same way with that land. What is the market at the moment? Is it for seniors? Is it for families? I mean, I don't know the question. I still am having a hard time getting my head around the fact that if there are people in St. Regis that can buy or have caused or can make a demand where units are built for them so they can buy them, why it isn't happening.
Because the land is so hard to find so inexpensively.
Well, aren't there some little rules too where you kind of have to have, you buy the land and then they're not going to loan you for the house right away because you haven't paid enough on the land?
No, like as a developer, but, so like, you know, they could go out and buy a piece of land and build a house and sell it. The problem is, it's really hard to find a piece of land cheap enough where you're going to be able to have that in-house be under 200,000. Because that's really where the demand is, according to real estate agents. But it's really hard to do because the land is so expensive, you know.
But it's one of those situations where, again, you're investing money and you hope not to lose it. So money is cautious. But there are some 2 and 3 acre sites in St. Regis in the sewer district that I've been told could be purchased. And a couple of them are next to the 2 rivers. So there's a 4 acre site just south. So somebody could come in there and buy that, develop. But again, that's pretty risky because you're putting all of the money into access. You're going to have roads. You're going to bring in the sewer. You're going to bring in whatever kind of water system that would serve it.
We've done subdivisions before, so I'm familiar with all of that stuff.
Yeah.
It's just really hard to find land that would get you an end product of under 200,000. And it seems to me like,
well, that
I mean, I can go and I can build a house for 240,000 too. That's easy. That's easy. Like anybody can do that. It's really trying to appeal to the families that would like to live in St. Regis, and that's under that 200,000, and that's where it gets really hard.
That's going to be almost impossible.
Yeah. Yeah.
Because we're looking at trying to build a small 2-bedroom bath and a half, and you're almost right at 150 to 170 just doing that.
Mm-hmm.
The other thing is that when you're trucking things out here, that's expensive to build out here.
When you're trucking stuff.
When you're trucking lumber, you're trucking all this
But
stuff.
you should be buying it local.
Well, yeah,
right?
but when you can, but
Yeah.
you can't always buy
Well,
everything
then you
local.
got the roofing materials and the
Mhm.
sinks and the carpeting and.
Yeah, most of that you can get here, but
So, and if you can find the builder, I mean, you know.
yeah. So I guess I was just really hoping to, I was just curious what you kind of had going, but then really I was just, because I heard, and I was even I said, well, it could just be a rumor, but this one person told me, no, specifically they are selling you a piece of property 2 times, 4 storage units for the commons, which is adjacent to the commons. And then Judy Stang also said that you were talking about storage units, so I must have been.
Yeah, we do talk about
So it
storage
is-
units, but it's in context of a tenant marketing
Yeah,
units.
Not separate.
Not
Right.
to the general public.
Which is,
And what size would those be? That's my deal is size.
They're going to be probably small. It depends.
like what's 5 by 10?
Yeah, something like that.
10 by 10?
Well, when you get up to 10 by 10, yeah, I don't know. You know, the incremental cost of building a 5 by 10 and a 10 by 10, you know, it doesn't cost you incrementally more to build a 5 by 10 because you're already mobilized than building a 5 by 10 so you can expand it to a 10 by 10. Incrementally, the cost is less. So I don't know, you look at all that stuff, and if you have the land and you have the access to them, then yeah, we might consider that. Again, part of it is my responsibility to those investors, both at Commons and Two Rivers, to keep those marketed. And as I see the market change, I have an obligation to offer amenities, whatever they are. Because again, those are private sector dollars, those are not grants. The million in Two Rivers and the 3.9 or whatever with Commons, those aren't government grants, those are private sector investors.
Very good.
I'm going to have to start more rumors.
Yeah. I know.
This is pretty tame. I thought there'd be rumors. When you said rumors, I thought, all right, now we're going to get down to it.
No, that's all.
No one's afraid of competition, okay? There's no one afraid of competition, it's just we don't want unfair competition.
Right, where you can market it for less. So, if you have a 5 by 10 and I have a 5 by 10, and you're going to charge them rent, and I'm going to charge them rent, that doesn't seem fair to me. It doesn't seem. That's not fair. If you can charge them less than I can charge them because you're a nonprofit, I have a problem with that. If
But you're always going to have
the
a
same
circumstance.
amount,
Yeah,
if
we're
you're
always going to
gonna-
have a circumstance where we're trying to market because it's a business, and we're going to have to do what we have to do to get tenants, just like any other business. So I'm sure there will be times when
your rent is less than ours, so
Mhm.
we're no longer competitive to your renters.
to some, yeah.
Yeah.
But the question is, how many of our renters are actually going out into your market? I mean, I don't know that, or how many would. If we offered it to them at some sort of discount, they might take it, they may not. The project we have in Hamilton, that's open to our tenants, but not all the tenants. That's why we offer some of it to the public. But that was all public. We bought that. That wasn't part of the project. It was really a situation where it was adjacent to our property, and the owners were actually using our parking lot to access their storage unit, and there was no access agreement, and so.
And that's where, well, at this juncture, that's where I would get back to my point about, you said you don't have to do that. You don't want to de-incentivize them earning more money, but there might be people that would be looking at John or Jessica's apartment or whatever initially when they don't have enough money So they get into your apartment because it's more available, or there's more of them, or
Mhm.
more and then they do get a great job, or they win the lottery. Then that's when they probably should be going back out and utilizing the people. Because like you said, how many people are going to be looking at them because they don't qualify? But some of them qualify soon after getting into the low income, but they just park their butts there because they're making even more money by taking advantage of your nonprofit instead of being in the real world.
Yeah, and it's an ongoing discussion on the other side is if you move them out because they make more money, then they turn down jobs to continue this subsidy. So this is one of those ongoing debates that you can make, a reasonable point on either side. The current IRS tax credit incentive, and again, that's private sector investment, is that the tenant can continue and that you incentivize them to make money because you're not going to remove them from the apartment. The government grant programs, they have an income that if you exceed it, then you're no longer eligible for the apartment. So that gets criticism because people then reduce hours or they don't take salary increases because they lose their rent subsidy. So either side has merit. But the housing tax credit program nationally probably is providing 70% of the new units for lower income. They're not subsidized. We just dropped the rents to below market. What's in the county where they're located below market, but they're not subsidized. And they're really geared toward moderate income. If your rent burden starts to exceed 40 to 45%, we really don't want you as a tenant because it's too much. We're having this conversation in Valley County. People want more rental units, and everybody wants a grant, which they really don't exist. I mean, some of that's a myth. You can get some grants and you do some small projects like the 3 units we're doing here. But if you're doing anything larger, you need private sector investment of some sort. But private sector investors don't like high rent burden either, because they understand that if people have 50% of their income going to rent, they're going to be moving out, they're not going to be paying their rent, they're going to be trouble. That trouble is expensive. You evict somebody, you have a vacancy, that's cash you're not getting for your investment. So you start looking at what are the incomes, and if you're in a community with a lot of lower incomes, and somebody they do the calculations and they go, well, geez, most of the people here would be at a 45% rent burden. They're not interested. So it's really hard to attract private sector investment on any scale. Yeah, there's some duplexes and fourplexes that get built, but if you have a severe shortage, which in Valley County they've been talking about, I don't see any private sector money coming in to build 150 units. Because you can't build them, get your debt service, and get your return on equity, and keep them stable. Because people are, once you hit that 45 plus rent burden. Now the argument against that is that in a lot of our counties, and this one included, people are actually at 50 and 60% of their income going to rents. But that also, then you have to dig into that data. How many of them stay in the same place, or are they hopping around? And if they're moving around, an investor doesn't want to see that. They want to give a good product. They want stability. They want people to take care of their unit and enjoy it, and they want that revenue stabilization. So it's a nasty circle, and you quickly get into, well, how do we raise the wages, which is what our housing task force in River Valley started talking about. We went, if we knew the answer to that, it's kind of above our pay grade. So how do you get those incomes up to attract private sector? So let's take St. Regis. If something happened in St. Regis where the incomes went up, I would bet there would be developers buying available property and building some spec homes, because that happens over and over in every community in the country. Well, without that, how then do you get that built? And that's kind of a tough situation, because to bring them in at where you want them to be.
Yeah, where they need to be for the people that actually.
But if they're under 80% of the area median income, they can get our loan program. So we have actually worked with developers in Missoula who, it's been about 10 years ago, but the city gives us money. And we targeted the money to 3 developers. You had to buy a home from one of those 3 developers. And then we came in with our second mortgage. And that was to incentivize builders to actually build within a certain price point. So that might be something we want to work on in St. Regis.
That would be interesting.
See, because our goal is, number one, to provide the housing that's needed and not sort of our preconceived idea.
Right.
But we don't want to lose money.
Right.
And then secondly, we have a loan product that we want used. So how do we get that done? So we're open. And that's why we're talking today, because we haven't, and I haven't come to any conclusion on that 11 acres. There's all these ideas we've talked about today, and maybe more we haven't talked about. But it's a little scary out there to just plunge ahead. Number one, because of the small number of people in the community, in the whole county. The incomes are low here, and there aren't any major employers close. So any way you go, you're going 60 miles before you hit some major employer. So that's scary.
That is scary.
Switching the subject just a little bit, since you're here talking about what you know. What do you know about the east end of the county, the Alberton area with those?
Well, you know, I saw those lots go on for that 1.25 acres or something, and they're selling, they're on the MLS for 37.5 or something.
The North Frontage Road?
That whole,
Where there's some
10 or
houses
12
on
of them. And they will require septic. They're going to have a common well.
And
so I assume they're not in the town of Alberton because they're not serviced by the sewer.
Water, yeah. Tim left. I didn't know if they were setting themselves up for a potential annexation by the city, though, from their proximity to town.
Yeah, that's a good point, but I assume that they're marketing to the Missoula market. And they're 1.25 acres, almost all of them. If you look on, you go to Realtor.com and put in Alberton, they come up. And they're all about 1.25 or somewhere in there. And I think they're 37.5. And they're advertised saying that there's a common water system, septic for each lot, and they say in their little blurb that they're in an area qualified for rural development. So now I was trying to do the math, and if you're paying 37.5 and you do 100 a square, 1,000 square foot, to make it simple, I mean, that's 100,000, so you're at 137.5, thereabouts, 150. So that's a reasonable price point.
That, I think so, and I think that's a really nice option for people. I think Missoula's taking full advantage of it. But no, I think that's a good price point right there.
Because see, in the city of Missoula,
even at 1,500 square feet, you're
Yeah.
you're below 2.
Yeah. Oh, yeah. Way
Yeah.
below. Yeah.
Yeah.
So Missoula last year, thereabouts, fall 2015, there were about 1,100 to 1,200 units on the market. If you do the MLS today, you're going to see about 515 to 520, and that starts at 6 million down to. So for our borrowers, they're looking at condos, townhomes, and very tiny homes. So there's a pent-up demand. That demand is going to start going, I think, down 93, up 93. I get corrected all the time because
The Bitterroot's up.
the Bitterroot is flowing down, Jim. So you're
Mhm.
coming up the Bitterroot, okay.
Mhm.
So, but I go down to Superior, okay. So
South. It's a downward on the map.
Yeah.
South.
Yeah.
So-
I would say down too.
have to be careful because
Yeah.
you know people are grumpy about things like that. So, so you go to Lolo because they have a sewer district. You go to Florence, they don't. So you got to buy the 1 acre plus.
For septic.
Or you go to Stevensville. Now up Barley, if you do the same thing with Realtor.com and type in, you'll see a bunch of lots again. They're at about 10 acres, and I think they're all at about 100,000. And that they're recent. These are recent additions. And I think part of that is an anticipation of the market in Missoula starting to expand out because people can't buy. And nobody is talking about any great expansion of spec homes. There are some on the market, and you can see those on the MLS. So then we've talked about how far will people drive, because Alberton, as you know,
25
living there,
minutes, 25 minute
boom,
drive.
boom, 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 you know, so that development might do well. What about Superior? Would people from Missoula come? I don't know. There's a ton of them coming up from down the Bitterroot. Up the Bitterroot, they're coming down from the Bitterroot.
Yeah.
They're going with the stream flow.
Yeah, they're going with the stream flow. So, and if you just watch, I mean, it's bumper to bumper in the mornings because we have an office in Hamilton, so I go down there pretty routinely in the morning, and it's just bumper to bumper. So people are driving now 45 to 60 minutes.
So the frontage road, the Alberton one, was 1.25 acres. Unbuilt remaining lots, they still have how many, did you say?
I think it's like 10 of them.
Wow.
I could be wrong, but they're, if you go on there,
I think they have a little bench back there too, don't they? They have more than
They
just.
do, yeah.
And see, I thought that one was a part of development that was hooked to Alberton Sewer, but I guess not.
Wow, I wasn't aware of. Tim would know, but.
Is that Mineral County?
Yeah.
Alberton.
I know, Alberton's
That one-
Mineral County, but there's a line there somewhere.
No,
The one right
it's
off of
west.
the
It's
highway.
right west of
The north
Alberton.
frontage road, right when you go by the Alberton
Right off
exit,
of-
not Petty Creek,
You'll
and
see
you
all
look on
this-
the right-hand side, the old Bestwick Ranch.
Oh, okay.
That
All
old-
those new houses in there?
Yeah, there's still about 10 or 11 lots left there, 1.25
Those are the
acres.
37.5.
Yeah, I think
Yeah.
so.
And Bernie Anderson was part of the developing it originally.
Originally, yeah, well, I think there's still a road named after him, Bernie Road out there. Yeah.
Now, whether you could replicate that in St. Regis, I don't know, because you wouldn't need 1 acre because of the sewer district. So your densities could be higher, and you could do it 10,000 square foot, 7,000 square foot lot because of the sewer. So if you got a couple of acres, you would have higher densities.
You could. Good. Jim, thank you.
Yeah, anytime. I mean, if you
Thanks,
Yeah.
guys.
if you
Thanks
think
for
of
coming
anything,
down.
let me know because we want to.
Thanks for pushing my wife out of the snow too.
Yeah, no problem. She said she was gonna bring me a beer. The 3 of us a beer.
3 of you, 1 beer.
And if you pick up anything, call me. You have my number because
Okay.
we're interested in doing something that works. We just don't want to get stuck with the property.
Sure, I understand. All right, thank you.